third hearing of Portfolio Committee number 5, Justice and Communities, for the additional round of inquiry into budget estimates 2024-2025. I acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands on which we are meeting today. I pay my respects to elders past, present, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islander people joining us today. My name is Robert Borsak and I am the chair of the committee for today. I welcome Minister Washington and accompanying officials to this hearing. Today, the committee will examine the proposed expenditure for portfolios of families and communities and disability inclusion. I ask everyone in the room to please turn their mobile phones to silent. Parliamentary privilege applies to witnesses in relation to the evidence they give today. However, it does not apply to what witnesses say outside of the hearing. I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants. I encourage committee members and witnesses to be mindful of these procedures. Welcome and thank you all for coming to give evidence today. Minister, I remind you that you do not need to be sworn, as you have already sworn an oath to your office as a Member of Parliament. I also note that all other witnesses have been sworn other than Ms Dean. Ms Dean, would you please state your name and position title and swear either an oath or an affirmation?
Yes, good morning. My name's Lauren Dean. I'm the Acting Deputy Secretary for Child Protection and Permanency, and I'd like to take an oath. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you. I will also remind all other witnesses that you have already been sworn, as I've just said. Today's hearing will be conducted from 9:15am till 5:30pm. We are joined by the Minister for the morning session from 9:15am till 1pm, with a 15-minute break at 11am. In the afternoon, we'll hear from departmental witnesses from 2 till 5:30, with a 15-minute break at 3:30pm. During these sessions, there will be questions from opposition and crossbench members only, with then 15 minutes allocated for government questions at 10:45, 12:45 and 5:15pm. We'll begin with questions from the opposition.
Thank you, Chair. Thank you, everyone, for coming today. Minister, last year during the budget, you published a media release identifying $7.1 million for a task force to respond to recommendations from the Disability Royal Commission and also the state reforms for NDIS. The media release detailed that the task force would be led by the Cabinet Office, with also staff from DCJ. Is the whole $7.1 million staffing costs?
Thanks, Ms McLaren-Jones. And just before I come to answer your question directly, which I will, I just might beg the committee's indulgence for a moment and say good morning, everyone, but also just want to send my wishes, and I'm sure everyone's wishes here, to the communities that are affected by the flooding up north at the moment. And I just want to extend on behalf of the government our wishes and best wishes from today, and but also to the people that are the emergency responders who are, SES, RFS, everyone that's on deck, including our public servants from our police, but also wanted to acknowledge that we've got several and a number of DCJ staff members who are currently manning evacuation centres up there at the moment as well. So just wanted to show gratitude to them and wish everyone well and to be safe. And to come directly to your question, sorry, Ms McLaren-Jones. No. The $7.1 million for the Disability Reform Task Force is an important investment in the complex work that's underway to deal with and responding to the Disability Royal Commission recommendations, alongside the NDIS review and the design work being done around foundational supports. And of course, this work, as you mentioned, has to be a whole of government response.
I was just asking if the $7.1 million was just for staff.
It is a critical investment in our capability and capacity in fact, this Disability Reform Task Force is leading the work nationally across all states and territories. And yes,
Minister,
and yes,
the question
it is,
was quite specific.
and yes, it is going towards our own capability and capacity within government to respond to all of these particular reform
it
pieces.
is for staff.
As I
That's-
understand, it is.
Thank you very much. How many full-time staff have been recruited for the Cabinet Office and also for DCJ?
That's a staffing issue. I will have to defer to
And this is just for the task force.
Deputy Secretary Ms Campbell.
Thank you, Minister. Yeah, there are 10 FTE in TCO, the Cabinet Office, and 9 FTE within DCJ.
Yep.
Which I might say speaks to the complexity of the work that's being done by a relatively small team, and as I said, leading the way nationally in terms of our government's response
Thank you.
to
I might
these
move
various
on. We've just got
reform
limited
work.
time. How many unfilled positions are there that currently, or is that the capacity, the 19?
That's the 19.
So 19 for 7.1 million.
Correct, over 2 years.
The response to the Disability Royal Commission, which was published, the New South Wales one, published in July last year, said that there were 50 recommendations that states and territories were responsible for. 85 were for joint, both Australia and states and territories. In going through that, I counted only 6 out of the 50 recommendations were accepted by New South Wales. The remainder were either accepted in principle or noted. Can you confirm that it's only 6 that the state has accepted?
As I understand, of the 222 recommendations made by the Disability Royal Commission, there were, I believe, 131 of them that were relevant to New South Wales, and of those, 91 were accepted in full, in principle or in part. So
I'm actually interested in where New South Wales has responsibility, not necessarily where the Commonwealth has responsibility. I'm actually talking about the specific 50 that were linked directly to New South Wales.
Well, we regard we are looking at 131. I believe that's accurate. There's 131 recommendations that are relevant to us,
Yep.
and that we are working on. And as I said, 91 were accepted in full, in principle or in part. And to be really clear, and I think I made this point at the last budget estimates as well, that those recommendations where we have said that they are subject to further consideration does not at all mean a no. And in fact, there's been considerable work being done, and as in accordance with our implementation plan that accompanied our response to the Disability Royal Commission recommendations, our focus is on those areas which are subject to further consideration, and that's been reflected in the work that we've been doing with stakeholders, closely in consultation on restrictive practices, on guardianship, supported decision making, those areas where we
But Minister,
want
you
to do additional
only
work.
put out a statement saying you accepted 6. If there are more that are being actioned and that you've said are accepted in principle, what's stopping you from updating that to say that they're actually being implemented as opposed to accepted in principle?
Ms McLaren-Jones, I just want to be really clear. What we want to do is be completely open, honest and transparent about the work that we are doing. Across community stakeholders in the disability sector, they are well aware of the focus and the work that we are doing, because we have been stating that it's set out in our implementation plan exactly what our intentions are for the work to follow from our Disability Royal Commission recommendation response. So that is set out in our plan. We are following that plan, and we are doing it closely in
6 have been
consultation with
accepted.
community. And as I said, 91 accepted in full, in principle and in part. We are progressing
New
on
South
multiple.
specifically for New South Wales, there are only 6 that have been accepted.
We
On
are
that-
progressing on multiple fronts, and as I said, we are doing the work on the recommendations that were under further consideration. Those work is underway on those as well,
Is it
and
fair
that's
to
in
say
accordance
that-
with our implementation
Is
plan.
it fair to say that the delays or the reasons you can't progress and have or been able to accept other recommendations is because of financial and budgetary constraints?
Absolutely not. disagree with that entirely. And in fact, I just want to correct the record that there are 8 of the recommendations that are relevant to New South Wales that have been accepted in full, not 6. But there is work underway across all of the areas that New South Wales has responsibility for in accordance with our implementation plan that accompanied our response to the Disability Royal Commission.
But 7.1 million for 19 staff versus being able to advance more recommendations, surely you could have put some money directly into disability supports and services.
Well, at this point, the work that we are doing is incredibly complex, and there are several intersecting parts, because we are not only looking, that task force is not only looking at the Disability Royal Commission recommendations, they are looking at the NDIS review and
But
our
it's still
obligations.
7.1 million for 19 people.
Our obligations in
Over
terms of
2 years.
foundational supports. So they are harnessing harnessing the work that's being done across government. So it's not just this team that is working on this. There are different officers and officials across all different government agencies that are
But
contributing
Minister,
to
you
our work.
allocated in the last budget 7.1 million for disability, and that went purely to employing 19 people.
That are
I
doing-
might
that are-
move
who are
on
doing
to
incredibly
some
important
specific
work.
questions in relation to the recommendations. Recommendation 9.2 that was accepted asks for all First Nations children up to the age of 5 coming into out-of-home care to be screened using the culturally adapted developmental screening tool known as Ages and Stages Questionnaire Transition Readiness Assessment Questionnaire. Do all Aboriginal children under 5 entering care currently receive that?
That was
Simple yes or no.
there's work being done underway with the health department in terms of ensuring that, and it's something that came out of the system review, ensuring that children in out-of-home care have access to all the health supports that they need. In terms of that particular recommendation, that work is underway with the health department.
But you accepted it in July last year, implying that it was done. And you're now saying that it's work being done by health, and you're not sure if... What we have already got in our health pathways, it's our health pathways agreement, is that every child coming into the out-of-home care system undergoes screening already. And my question
is
that happening?
That is an agreement. That is an agreement that was already in place and work that was already being done. In terms of that particular assessment, I might ask Ms. Dean to respond as to whether that particular assessment is in place yet.
Ms McLaren-Jones, thanks for the question. In relation to the assessment, all children, young people entering out of home care require a health assessment within 30 days of entering. I'll have to take on a notice whether it's that specific assessment that's included. I can come back to you this afternoon.
But Minister, it's fair to say children in your care, out of home care, and you're not aware as to whether or not this assessment's being done.
Ms McLaren-Jones, what I would say to that is that I am aware that we have a plan in place and actions in place to ensure that children who are coming into out-of-home care, whether they are Aboriginal or non-Aboriginal, have a screening assessment as to their healthcare needs in the first 30 days of coming into the department. So to suggest that we aren't across the healthcare needs of the young children coming into the system is
screening
inaccurate.
Tool that you said you accepted, and you're not even aware whether or not it's actually being done.
Well, as I have already...
I might move on to
As
another.
I've already said, there is a number of pieces of work happening across a very complex area at the moment.
But we've found
and we will
you've
come back
only
to you this
accepted
afternoon
8.
as to whether that...
And this is one of them, and you don't even know if you've done it.
Can I just take a point of order?
Order.
The Minister is trying to answer a question. She's on multiple occasions now, Ms McLaren-Jones has interrupted her as she's been attempting to answer. And to throw a gratuitous commentary and...
Happy to move on.
Yes, happy to move on.
Yeah, good.
Thank you very much. I'd like to refer to recommendation 7.36 to improve social housing operational policy and processes that are inclusive. This again was also accepted, and the response states that it would be implemented by late 2024. Has that been implemented?
In terms of our
operational policies around social housing?
Our government's focus on improving accessible housing is absolutely one of our key focus areas, and we're making progress. Because we've made...
Minister, the recommendation, and you actually stated, would be implemented in late 2024. We're now in March 2025. I'm just asking whether or not...
If I could
you're aware
answer
of
the
this
question,
has
Ms
been
McLaren-Jones.
implemented.
What we have done in terms of accessible housing in the state is make the largest ever investment in social housing
Minister,
in New
I'm
South
not
Wales
asking
history,
about
which
Minister
addresses...
Jackson's portfolio. I'm asking you specifically about that policy and if it's been implemented. I'm happy for you to take on notice if you don't know what you've
I'm
implemented.
saying it addresses the decision that we made to make the largest ever investment in social housing, which means that it is the largest ever investment in accessible housing in New South Wales history. That's $5.1 billion.
Minister, this is not
That is
about
doing
bricks and mortar.
8,000
This is about policy and operational procedures. I'm asking whether or not that recommendation has been implemented. If you're not sure, I'm happy for you to take on notice.
And those policies and operational procedures are in place in terms of
So you're saying it was implemented?
largest
Thank you.
ever investment in accessible housing in New South Wales history,
So you're saying that policy was implemented?
as I understand.
Moving to recommendation 8.21 regarding the diversion of people with cognitive disability from criminal proceedings. New South Wales accepted this recommendation and the response said New South Wales would consider options to expand the Justice Advocacy Service subject to its outcomes of an evaluation. Do you know the status of this evaluation?
The issues around people with cognitive impairments and the justice system are significant, and the Disability Royal Commission highlighted the efforts that we all must go to ensure that people with cognitive disability are being given the support and services they need
Minister,
when
I'm
they are
asking if the
interacting with the justice
evaluation-
system. That particular program has from conversations I have had anecdotally, has proven to be a great success, and it is under evaluation. And I'm looking forward to the results of that evaluation. I have not seen the final evaluation of that program yet, but I do know that from all accounts I have heard so far that it is achieving good goals.
Does that mean that the services will be expanded as per the response from New South Wales Government?
I will await the outcome of the evaluation, Ms McLaren-Jones.
In regards to recommendation 8.9 about the use of seclusion in New South Wales Justice, Health and Forensic Mental Health Network, this recommendation was also accepted. Can you provide an update on the reviews in regards to that and what is now occurring?
Obviously, well, let me start again. Another area of focus of our government, following our our response to the Disability Royal Commission recommendations, was around restrictive practices. They occur in all types of settings. Obviously, when we're talking justice health, it is in the domain of my colleague, the Minister for Health, and well, actually, it'll be in the Minister for Corrections, but there's intersections with us all, and we all take this area with enormous responsibility, because we know that restrictive practices, in effect, restrict people's rights. So the importance of this area, and this is reflected in our considered response to the recommendations, that we said it was subject to further consideration, which is a reflection of the complexity of the issues that we're dealing with, because it does cut across justice, health, education, and disability areas as well. So we have been progressing conversations around. We issued a paper, I think it was late last year, a consultation paper around restrictive practices that I believe closed for submissions on the 28th of February. And we are considering those submissions and continuing to do an enormous amount of work in collaboration and consultation with disability stakeholders, particularly the Council for Intellectual Disability.
Minister, in regards to recommendation 9.1, to develop principles and guidelines for parenting capacity assessment for First Nations parents with disability, I assume culturally appropriate parenting capacity assessments is something that your department does know, particularly around out-of-home care portfolio. I wanted to know why that was accepted in principle rather than accepted.
The parenting capacity assessments and for our First Nations families is a really important piece of work. There are complexities in understanding what that would look like, and like everything that we are doing with any interactions and any decisions that we're making that may impact First Nations families or children, we must do that in close consultation with Aboriginal stakeholders. So I suspect it's the case with this that we want to do the work in terms of consulting to understand what it is that would address our responsibilities under that recommendation. And so whilst we don't have a clear pathway, we don't want to paint a picture that we're going to be able to respond as quickly as possible. So I suspect that's the case. Ms Dean might be able to.
Minister, I
shed some
asked
more
you a
light
number
on
of
that.
questions around specific recommendations. The majority of those were ones that you accepted. On average, your response has been, we're still doing work, looking at it, or it's another department's area. My concern is that you're spending $7.1 million on 19 department staff and actually not delivering services on the ground. Is that correct?
Well, I reject the premise of the statement entirely, because there is enormous amounts of work being done across all of the recommendations that we are responsible for, and there is important work being done that is going to change the face of disability services in this state. That's being done by that Disability Reform Task Force. We are leading the way nationally on the conversations about what that would look like, and we are proud of the work that's being done by that
we look
task
forward
force.
to seeing the next update that will have everything implemented. Just in the remaining time, Minister, are you aware that the accessible toilets at Strathfield Station have been closed since mid-December last year due to sewerage maintenance issues? And the response from the then Minister for Transport was, and I quote, "Staff are trained in disability awareness and are familiar with interim alternative toileting options. These options include using Burwood Station 1.3 kilometres away and the shopping centre. Is this an acceptable response from your government?"
Ms McLaren-Jones, if that's the case, we're happy to look into it. And I know I became aware, and I don't know if it was this station or another, but we became aware of a station where there was accessible toilets that had not been available for some time, and it is these ones. We ensured that there were accessible toilets installed as soon as we became aware of it, and they have been installed.
And is there a maintenance schedule across transport, whether it's toilets or lifts, to ensure that they're working and response is quickly implemented?
Well, I can say that Transport for New South Wales and their focus on accessibility has been extraordinary. And under our government, there has been an incredible investment in ensuring there is increased accessibility of train stations, wharves, and public transport across the network. So yes, it would be under the same maintenance responsibilities as all of their assets, which
Are you happy to take
I
that
must
on
say,
notice?
under our government, have increased accessibility across the state.
Are you happy to take that on notice?
What would I be taking on notice, Ms.
Whether or
McLaren-Jones?
not there's actually a maintenance
All right,
plan?
I'll
come back.
I'm saying there is maintenance across the transport network, which is in alignment with their focus on increasing accessibility across the state.
Thank you. Good morning, Minister, and thank you for the acknowledgement of what we're going through up north. It's very real for everyone, and without saying the obvious, we definitely did dodge what could have been unbelievably worse than what we're experiencing. Minister, I just wanted to ask you if you could update the committee on what is actually happening with the Office of Children's Guardian. I know that I think you've announced, and if you could confirm, that Barrister Kate Eastman is undertaking the inquiry. Is there any detail about the timing and the terms of reference for that investigation at this point?
I certainly can, and thanks for the question, Ms Higginson, and appreciate your strong advocacy for your community and have been looking from our area that also often gets impacted by floods and looking north and seeing what's going on up there. I know everyone's thinking about the families in your area. In terms of the Office of Children's Guardian, I have stood up, as you are aware, a special ministerial inquiry under Section 82 of the Government Sector Employment Act. I met with the Guardian on the 26th of February, and he agreed to stand aside whilst the inquiry is underway. The inquiry itself was established on the 5th of March, and Ms Eastman was appointed to lead that inquiry on the same day. And the terms of reference of the inquiry have been published on the DCJ website.
And what is the reporting date for Ms Eastman?
No reporting date has been set, but we're anticipating it to take about 4 months.
Thank you. Do you see this as a potential opportunity to look at implementing the recommendations of the FIC report in relation to an independent office, Children's Protection Office?
To be honest, Ms Higginson, no. The inquiry is into the culture and other related matters in the OCG itself, and what my focus during this whole time is on ensuring that the important work that's undertaken by the Office of Children's Guardian continues and the wheels keep turning as they should to keep children safe across the state.
But if for some reason the special inquiry looking into it had that suggestion, is that something you would be open to receiving advice about, a better system, if in fact that is the result?
Well, I acknowledge your ongoing advocacy on this front, Ms Higginson, and appreciate that work is underway elsewhere across our department. It's in terms of the Office of Children's Guardian at this point in time, our focus is ensuring that it is a safe and healthy workplace, and that's why we've stood up the inquiry. And it's just been pointed out to me to correct that the terms of reference says the report date is actually the 30th of June this year.
Thank you. Minister, just in relation to the work that you saw as priority work in relation to the unaccredited ACAs, and I know you always point out there's no such thing as an accredited ACA, but can I ask how many children remain, if any, in an unaccredited ACA?
Thank you for asking a question about an area that has been our main focus since we came into government, because as you know, there were far too many children that were placed in hotels and motels, 24/7 shift workers with unaccredited agencies, which in effect meant that they weren't required to meet the New South Wales Child Safe Standard for permanent care. So we have had a laser focus on reducing that number. The number of children when we stood up the HCEA task force was in ACAs, that's the unaccredited placements. They were 139 in November 2023, and there's been a 94% reduction, so that there are only 8 children remaining in those arrangements. But importantly, our focus has not just been on the worst type of emergency accommodation, it's been on reducing the entire cohort of children and young people in high-cost emergency arrangements. So we have now not only reduced the ACAs by 94, number of children in ACAs by 94%, we've reduced the number of children in all high-cost emergency arrangements by 35%. So that's fallen from 506 children in November 2023 to 328 in February 2025.
Of the 8 children that are still in those arrangements, what ages are those children?
Ms Higginson, I
Yeah.
don't know specifically, but I can say that they are that we have got a plan in place for those children to be placed in more safe, stable housing to give effect to my ban on these arrangements by the end of this month.
So what's the reason, what are the primary reasons that those care arrangements remain unaccredited for those 8 children?
Because of the complexity and of their situation, we must ensure that they are safe. These are children with enormous fragility, and we just have to tread very carefully in everything that we do, as we have done for every single child and young person.
Would you be able to take on notice and provide to the committee, like, what are the actual reasons that those 8 children are, like, the places that they're currently in care, why those arrangements and the care being provided is not accreditable?
What I can say is that the children that have recently been placed in more stable, safe placements have been sibling groups, and we've only been able to achieve that by standing up our own new residential care services, the Waratah Care Cottages, the government stepping in to be a provider of residential care for the first time in 20 years. We've stood up our own cottages, and that's allowed us to place some of these sibling groups that were in high-cost emergency arrangements and place them together. These were young children, siblings, who worked together whilst they were in high-cost emergency arrangements and are now living in very home-like accommodation in our Waratah Care Cottages with full wraparound therapeutic supports.
Thank you. Can I ask, of the 8 children, how many are Aboriginal children?
I will have to take that on notice.
Thank you. Do you have, and take on notice if you need, how many Aboriginal children remain in accredited arrangements that are the high-cost arrangements?
I haven't got it in front of me right now, but we'll be able to provide that to you this afternoon.
Thank you. And I think you've given me the number of the 500... I think you've given me that number. Thank you. Also, I just wanted to ask you, just before I hand over to my colleague, about there was a coronial inquest in relation to a 17-month-old First Nations girl, the identification of ML. The report was available 5 days ago through the Coroner's Court. I understand that may now not be available because of publication orders and trying to sort things about the legality of that report. But one of the reasons stated was that there was a significant lag time between a new report from the DCJ helpline and a response being completed by caseworkers. And there's an example given of that lag time. What is the quantum of under-completed responses in the New England area? Or perhaps what have you done as the Minister to try to rectify the issues that were identified in that area?
Ms Higginson, I haven't yet had an opportunity to look at the specifics in relation to the coronial inquest that you're referring to. But as I understand, there were no findings made against the department, which is not to say that we don't have a lot to learn from every single coronial inquest involving children either within the system or connected to us. So obviously we'll be taking a close look at what those recommendations are, but I can only suspect that it was closely linked to our caseworker vacancies and the shortages and the challenges that we inherited in a system where we had caseworkers who haven't felt valued for years, were walking out the door. And so in response to that work, we have been doing an enormous amount to attract new caseworkers and to retain the caseworkers we have. And that's by various measures, including lifting the wages cap and delivering the biggest pay rise that they have seen for a very long time, including a new pay bump for new caseworkers, over $8,200 for a new caseworker and a pay bump now. But obviously pay and conditions is only part of it. Our system reform is critical to ensuring that we have a workplace where caseworkers want to work. And that is a key focus of ours, and the system review pointed to the need to do a lot more for our caseworkers and our DCJ staff to make it a safe place for them to work, as well as getting the best outcomes for children.
Thank you.
Thank you, Sue. Ms Hurst.
Wonderful. Thank you. Thanks, Chair. Thank you, Deputy Chair, and good morning, Minister. Minister, we recently passed in the Upper House my motion on child abuse prevention and the need to introduce prevention and intervention education programs. And I thank you for meeting with the child sexual abuse survivor Emma Huskinson and the Australian Childhood Foundation. And I also thank you for working with our office in helping to get that motion passed. I wanted to ask, why do you think it's important that safe adults are equipped with the knowledge on how to help identify and support children that may be being abused?
Thank you, Ms Hurst. And I've got to say, it was my absolute pleasure to meet Ms Huskinson. The two Emmas were a force to be reckoned with. and discussing such an important issue around the prevalence of abuse, neglect, and particularly sexual abuse across community. And as we discussed with Ms Huskinson, and the child maltreatment studies findings were shocking in terms of the prevalence of sexual abuse across our state and across our nation. And it's often something that people find deeply uncomfortable to talk about, but it is something that more people ought to know about, and to be able to understand what signs there might be of people who have experienced it, and allow opportunities for people to disclose safely. So it is an important conversation, and appreciate the meeting and working with us on what you've ultimately prepared to Parliament, or presented to Parliament, I should say.
Thank you. And you mentioned the Australian Child Maltreatment Study, and the work that the Australian Childhood Foundation is really doing was actually bringing the voices of survivors forward. And what we heard from survivors was really that they felt that safe adults had really let them down, and that more people, if they knew the signs, could really have actually intervened earlier and really helped many of these children to avoid further abuse. What do you see as a major part of that going forward in actually educating safe adults to be able to protect children right across the community?
Yeah, and I appreciate the hearing, having put a spotlight on the voices of victim survivors, and having them help us, help inform a response, particularly ensuring that communities, people everywhere understand what it might look like, and providing that safe pathway for conversations. But as we discussed, there is an enormous amount of work being it's underway under the responsibility of my colleague, the Minister for Prevention of Sexual Assault and Domestic and Family Violence. So there is, for the first time ever, the package of early intervention prevention that is a significant step change in our state in terms of ensuring that there is an education piece that comes with understanding what healthy relationships are and what they look like. And so there's a number of different elements to that early intervention plan, and I want to understand where, if there are gaps, we might be able to do more.
Thank you. And then the motion passed was really about that research from those people with lived experience and specifically what they were calling for. And the motion asked the government to investigate avenues for the Child Protection Working with Children's Act to require mandatory child abuse prevention and intervention education for registration to receive a Working with Children's check. Can you let us know what the first steps of that investigation will be and what will be the next steps from your office now that this motion has passed?
Well, certainly since I became Minister, there has been work done with the Commonwealth and across states and territories in terms of trying to make the Working with Children's check consistent across the nation, and in the first place, ensuring that we have got adequate data sharing across different states and jurisdictions, so that we have got those robust systems in place. But in terms of the next steps with potential additions to the Working with Children's check, that's a conversation that I want to take to the Commonwealth, as we discussed, to determine whether or not there's an appetite. And as I understand from the conversation with Ms Huskisson, she has met with the Commonwealth already, and that there was a positive response from Minister Rishworth. So I'm very keen to have that conversation with Minister Rishworth and see what work we might be able to do as a national response. But saying that, obviously, as a state, we are responsible for delivering the Working with Children's check ourselves. So we will start with the Commonwealth, work out where they would like to go with it, and then work out what, if anything, we can do as a state to make our system more robust.
Fantastic, thank you. And you did mention, that second part of the motion, which was advocating for the Commonwealth states and territories to nationally harmonise the Working with Children's check system, which I understand you've already been working on that already. And then the other part of that was advocating for that harmonisation process to develop the education and training nationwide, so that is a sort of a training package. Is that something that you'll be advocating for nationally as well, that if there is a training package that is done on a national level, so that, again, we see that harmonisation across states and territories?
There's certainly, certainly through the Community Services Ministers meeting, I'm keen to raise it through that process, so that we can have that conversation across states and territories and with the Commonwealth.
Thank you. And when is that next Ministers' meeting?
I know that it's coming up. I'm not quite sure of the date, though.
Okay.
And as to whether it can, I think the agenda will already be set for that that meeting. So I'm not at this point suggesting it's going to be at the next one, but I'll try and have it placed on the agenda in the future.
Fantastic, thank you. And so when, and I understand obviously that this motion has only just passed, so when I use the word timeline, please understand I mean that quite liberally.
Yes.
But, do you have sort of a rough idea regarding sort of investigating this potential change to the Working with Children's check system, and when we might actually have further steps from government or further ideas in this space from government?
Well, if there's one thing I've learnt since coming into government, that things take time, even though there is often an urgency to the need. So I can't at this stage indicate a time frame. And as you said, your motion was moved in the last sitting of Parliament. So I'm happy to keep the conversation going, and particularly in the first instance, as I said, with the Commonwealth.
Great, fantastic, thank you. Thank you.
Thank you. Minister, I'm just going to quickly go back to the tragic death of the 17-month-old child. I know that the response time was a 72-hour response time, and I'm just curious about at this point. I mean, it's beyond acceptable what's happened, regardless of the government's work, which I accept, to improve caseworker numbers, and I know that that's really important. And systemic reform is exceptionally important, but in this situation, where a baby's dying because perhaps a caseworker wasn't available, has anything been done to rectify that immediately? Are there more full-time staff members in the New England? Is it specific to the New England region? I just think that what we have learned is already too much to not already be acting upon.
Well, Ms Higginson, if there is, there's a few things from that. Without knowing the actual detail of the coronial inquiry, I don't yet understand whether or not it was the tragic death of a baby has been as a result of anything by the department. But saying that, we have been acting urgently to ensure that we are able to respond more quickly to concerns raised and risk of significant harm concerns. And one of the things that we have done is redeployed casework specialists back to the front line so that they are now holding more cases so we can see more children. So that we've now got casework specialists return to the front line. I think across the state, that's 44 additional caseworkers on the front line that have responded to, I think, a significant number of children's, I think about 300, about 300 additional children have seen because of that response and the redeployment of our casework specialists back to the front line.
Thank you.
Thank you. Minister, I'd like to turn to some of the data that's on the DCJ website regarding the number of children in residential care. The latest dashboard shows that as of the 31st of March 2023, there were 816 children in residential care placement types. And as of the 30th of September, which is the latest dashboard, there were 913 children in residential care. Is it fair to say that's a 100 increase since you came into government?
I would have to check our figures. But yeah, Mr O'Reilly's just said there has been an increase. But I would say that the residential care is intensive therapeutic care placements, and those placements are involve necessarily, as the name suggests, therapeutic supports provided to the children in those settings. Much, much better than being in an unaccredited hotel or motel with 24/7 shift workers, as was the system where too many children were placed that we inherited.
So it is fair to say that the 100 children that were in ACAs have gone into residential care?
Absolutely not. Absolutely not. So there have been, if you would like me, and I will actually do this for you, Ms McLaren-Jones, the 313 children who have exited alternative care arrangements between November 2023...
Sorry, I think you misunderstood. I'm asking if the 100 children over that period of time that have gone into, the additional ones have gone into residential care, have they come from ACAs or other high-cost placements?
Ms McLaren-Jones, I'm just going to have to explain for a moment that the figures that I've talked about, a reduction from 139 to just 8 children, doesn't...
No, I'm not talking about ACA, Minister, I'm actually talking about residential care. So since you came into government, there's been an additional 100 placements in residential care.
Right.
And I'm asking whether those additional placements have come from ACA placements or other high-cost placements. I might give you take on notice.
No. I understand your question and I'm trying to answer it. Because, and just the premise of the question I'm curious about, because it seems to be you seem to be suggesting that the children will be better off in unaccredited
No, I'm not,
hotels and
Minister. I'm actually
motels
just
with
asking
24/7
if those
shift workers
additional children
than
have
in a
come
therapeutic
from
place,
high-cost
residential
places.
care
Order.
placement.
It's quite a simple question,
Chair.
Minister.
Order.
It
As
is.
a matter of fairness, the minister's been asked a question. I think the minister's now had 4 goes at attempting
But she's
to
not
answer
actually
the
answering the question.
Order.
Just
Minister can
because
answer.
the honourable member doesn't like the answer that's been given, it isn't a reason to talk over
It's
the
quite a
minister and
specific
ask new
question.
questions.
Order. The
And-
Minister, as you know, can answer the question or not any way she likes.
And
Don't
I am
hold the point of
answering.
order.
Sorry, Chair.
Sorry.
Sorry, Chair. And I am answering directly, because when I say that the children in ACAs have reduced in number from 139 to 8, that does not just mean that 100 children have been reduced from that cohort. Children have been coming in and out. So in that period of time, there have been 313 children and young people that have exited ACAs. And from
Minister,
those,
we
of
have
those,
actually covered this
of
when
those-
my colleague asked before. I was quite
Order.
I'm
Order.
trying to answer your question, Ms McLaren-Jones.
Order.
Of those 313 children who have
That's not
exited
my question, Minister.
exited
I'm asking
ACAs,
about-
they have
Order.
gone to.
Order.
Point of order,
No,
Chair.
Minister, I'm
Point of
sorry.
order,
Chair.
My question.
Point of order.
Point of order.
The minister
understand
is
the question.
attempting to answer the question and being directly relevant. The Honourable Natasha McLaren-Jones continues to interrupt and speak over the top of her. I would ask that you direct her to your previous ruling and the procedural fairness resolution adopted by
To
the
the point of order.
House.
The minister's actually talking about ACAs. I'm asking about residential care numbers. They're two totally different things. I'm sure the minister knows
Further
that.
to the point of order.
Order.
Further to the point of order.
Well,
As
I refer
you've
to my
said in your
previous
ruling.
I mean, the
Yeah.
minister, if the minister isn't answering
I'm
the
happy to
question-
move on because she's not
No,
answering.
Ms McLaren-Jones,
she's
I
capable of answering
absolutely,
it.
I
Order.
absolutely want the
To the point of-
opportunity to
to
answer
the
this
point of
question, and
order,
I'm
Chair.
answering it directly. There were 104 children exited to foster or kinship placements from ACAs.
Point of order.
There were
The minister's not actually
105
answering this
Point of
question.
exited.
order. Point-
to-
let me
The
hear
minister's
Minister, let me.
the minister was asked
Please let me
specifically
hear the
about
point of order.
residential care. She's talking about ACAs. I'm happy to move on
I'm
because
not-
they are two totally different groupings.
To the point of
To
order,
your-
Chair. It
This is actually now wasting
entirely
my time.
it is entirely up to the minister as to how she wishes to answer the question, as long as she's being directly relevant. The minister is being directly relevant.
She's not
Just
being
because
directly relevant.
The Honourable Natasha McLaren-Jones doesn't like the answer doesn't mean that she can direct how she should be answering the question.
To the point of order, she's not being directly relevant. I'd
Ms
like to move
McLaren-Jones,
on.
your question specifically said how many children out of ACAs were moved into residential care.
No, I asked
ACAs to
Minister.
residential care, and I'm answering where the children have gone out of the ACAs.
Minister, I didn't ask that question. I asked about the 100 young people that have gone into residential
From
care.
ACAs?
No. Have they come from ACAs or other high-cost
Correct.
placements?
So
Have
I'm
they?
telling you where the
It's a
children
yes,
from
no
ACAs
answer.
have gone instead of the residential care that you're suggesting
No,
that
I'm
they
just
have.
asking where those
Perhaps-
additional 100
perhaps
came
the
from.
member should move on.
I
No,
think
I
that's
think the
probably
minister
best.
should be allowed to answer
Minister,
the question.
Minister,
Is it fair to say that it's actually better that a young person is in foster care as
Point of
opposed
order,
to...
Chair. The minister has attempted to answer this question multiple times, and she should be allowed to do so and put on the record.
to the point of order,
answer
the
to
chair
question.
actually asked us to move on, and I'm moving on.
no, we'll move on. We'll move on. The minister can read that onto the record later on if she thinks it's entirely relevant.
Thank you, Chair. I will do exactly that.
Thank you very much. Minister, is it better for a child to be in foster care or kinship care rather than residential care?
Ms McLaren-Jones, the ideal placement for a child and the ideal place for a child to be is safely with their family. That is the goal of our system reform. It is the goal of our of all the work that we are doing is to provide safety and support for families so children can stay safely at home. Where that is not possible, there is, according to the legislation, a priority, a hierarchy of placements, and yes, foster care, well, kinship care is preferable,
Thank you very much.
and then foster care.
Thank you very much. Minister, in that same time period, there's been a decrease of 600 placements from 5,681, which was on the 31st of March 2000 2023 to 5,073. That is of September 30, 2024. That's a trend of a decreasing number of foster and kinship placements. Minister, why aren't you investing in foster carers?
Ms McLaren-Jones, I don't understand the numbers that you were referring to. What were they? You're just throwing a couple of numbers
dashboard
around, and I don't know what they were actually about.
It's from your own department dashboard.
Yes, but you need to tell me what numbers and they relate to.
It's foster care placements.
Right.
And you'll
Thank
be aware that there's been, even over the last 12 months, 1,000 foster carers have left. You're aware of that figure?
I am aware that when we came into government, we inherited a system where
Minister,
foster carer numbers were plummeting.
You've been there 2 years. You are aware that there's, over the last 12 months, 1,000 foster carers that have left the system.
And what we have done as a government, and is what you didn't do when you were minister, was for the government itself to step in to the recruitment of foster carers, and we have now
Minister,
recruited 211 emergency foster carers. We have recruited, as a government, 211 emergency foster carers, so that who have now supported, I think, 971 children in their placement into the system. But saying that, I fully acknowledge that there is an enormous amount of work that we must do to better support foster carers. It's in the system review. It will be part of our focus going forward, because I have met with so many carers across the state. Every time I travel anywhere, I'm meeting with carers, I'm meeting with children who are in the system or just out of the system. And what the consistent message that I'm hearing from foster carers across the state is they feel like they are bottom of the barrel. So we are doing work in the system that we have inherited. We are developing a carer strategy to ensure that they have the support that they need, so that we can try to keep more carers in the system. We are also going to be under the current.
Thank you very much, Minister. Can I actually just move on to the cost of residential care placements? And it would be suggested to be the tens of millions. I'm happy for the department to take on notice. The additional 100 placements for residential care, how much that has cost since March last year?
What I can tell you is that the reduction in the children in alternative care arrangements has been a cost reduction of 148 million. The reduction of children in all HCEA types has been a cost reduction, I think, of 143 million. So there has been significant reductions in cost across the system because of the laser focus we have had on ensuring children are no longer in unaccredited hotels and motels with 24/7 shift workers.
Minister, in relation to, and I'll go back to residential group homes, and the numbers, and we've seen an increase under your time as a minister. Is it fair to say that, and these homes do cost tens of millions that we know, I think IPART estimated back in 2015, each young child in what was then called the residential interim care services, that was before the PSPs, was 320,000. So we're talking about millions going into residential care homes. These young people still have a rostered staff 24/7 to the age of 18. Again, I ask you, why aren't you investing in foster carers and getting young people to live in a stable home with a foster carer rather than a group home?
I will continue the answer that you wouldn't let me continue to provide before in terms of supporting foster carers in the first instance. We are ensuring that there is greater transparency and accountability across the system for our carers. We want to ensure that every carer understands how much their provider is receiving for the children that are in their care.
But you're losing thousands
we
a
are
year.
taking steps to ensure that carers have greater control and feel valued in the system.
Minister, can I move on to the Waratah cottages?
It seems that you don't want to hear any good news stories, Ms McLaren-Jones, because I can tell you we have been cleaning up a significant mess that we inherited directly from your
We talk about
government.
plans and initiatives, but we're still seeing thousands of foster carers leave. And I'm happy to talk to the department about some of the specific things they're rolling out later this afternoon. But in the time that I have available, Minister, I wanted to ask about the Waratah care cottages that you announced last year. How much is being spent on those cottages? There's 5 of them, is that correct?
I just was recently, last week, at the opening of the 3rd cottage. There are 5 that are planned, so 3 are operational with now sibling groups of children that came out of alternative care arrangements where they were in hotels, motels with 24/7 shift workers and now are in beautiful home-like settings with therapeutic wraparound supports.
So all 3 of those cottages are for sibling groups?
Yes,
And
as
then
I understand.
There'll be 2 more cottages coming online shortly. They'll
Correct.
also be for sibling groups. Great.
Correct.
how
And the
much-
first time in the for the 20 years that the government has directly delivered residential care services, and we've done it to specifically respond to the urgent need to get kids out of hotels and motels.
And how much is being spent on those 5 cottages?
I will have to defer to Mr.
Yep, I'll have to
O'Neill.
take it on notice.
We can take it on notice and come back with a forecast because, again, only 3 of them have been established so far. We can come back with a forecast.
That's fine.
The cost is being offset by, obviously, the reduction in emergency placements, which are far more expensive.
Yeah. And are the staff are they department employees or contract staff?
Well, it is a pilot at this point, and so at this stage we have got I believe there's a hybrid going on where we have some contracted workers under the supervision of department staff. Mr. O'Reilly, is that accurate?
That's correct. We have a hybrid at the moment. One of the challenges here is that because DCJ hasn't run residential care for some time, we need to re-establish an employee award to do that, and that work is underway at the moment with our employee relations team. As the award comes together, we're using DCJ manager and contracted staff who are familiar with the Sherwood model.
And what are the qualifications for the staff there?
They are similar to other therapeutic care qualifications, but we can come back with something more detailed later.
And I believe that the appointment of these staff for these vulnerable children is being done in a joint way with the department, so that our department has a say in who's being placed into these positions as well, because we want to ensure that we have the best support for these children who have already been through a lot.
Moving back to the residential care homes that currently exist, interested to find out what is the youngest age of a child that is currently in residential care?
Ms. McLaren-Jones, I'll have to take that on notice at this point. And I just touching on the residential care questions, there has been an expansion of intensive therapeutic care placements to respond to the need to have children no longer in ACAs or high-cost emergency arrangements. So we've expanded that program, and we've also reduced the vacancy rate across all intensive therapeutic care placements. When we came into government, the vacancy rate was as high as 47%. We've halved that across the state, where it's now sitting at just 20%. That reduction has allowed us to continue to drive down the cohort of kids in high-cost emergency arrangements and to provide them with therapeutic placements, home-like placements, as opposed to hotels and motels.
Do you have the average cost of the ITC?
We'll take that on notice and provide that this afternoon as well, I would say.
Thank you.
But I can say that hotels and motels and unaccredited alternative care arrangements could cost upwards of $2 million a child, so which is an extraordinary outlay for the poorest outcomes. And that was the system that we inherited, where there were more and more children being placed in these types of unaccredited emergency arrangements. And we have been doing the work, and in a short space of time have seen those numbers turn around by 94%. This is a good news story.
Thank you
this
very
is
much.
a good news story.
Minister, you were talking about the ICT group homes. How many additional placements have been contracted with this expansion?
again, that's something that we can come back to you with the numbers this afternoon. But again, I will say that those placements have allowed.
152.
Mr. O'Reilly's just said it's 152.
152, thank you.
Additional placements, which has, I mean, children have somewhere else to go other than unaccredited.
And I'm
High cost
confirming that
arrangements.
they also have rostered staff 24/7.
Yes.
Yeah. I might, in the remaining time, just ask about in Western New South Wales, Dubbo, you advised in response to a question on notice, number 3035, regarding the EOI process that would commence on the 14th of October and closed on the 11th of November. I also asked about the delay of that EOI. You said it allowed extra time for applications. Now, I understand that is still hasn't been finalised and we're now in March. Could you please advise why there has been a delay?
Well, as we responded to your question on notice in relation to Western New South Wales, the applications are the expression of interest wasn't delayed as such. It was allowing time to ensure that there was the capacity and capability in that area to respond to an expression of interest. We're working closely with ACOs on the ground to ensure that we can actually stand up services that we need in that area. So, and I'm advised that the applications are currently under the assessment phase.
But they closed back in November? Oh, yeah, November the 11th.
Well, they're under assessment, and it's a process that's playing out, and it's being done respectfully with the providers on the ground.
Okay. How many cases have been transfer of Aboriginal children from the department to ACOs?
This, as you would well know, this is a really complex area, but it is incredibly important to ensure that Aboriginal children and young people are getting access to the cultural supports and services that they need for their well-being, that can be provided through Aboriginal community-controlled organisations. So there has been a rather, I don't want to say significant increase. There has been an increase in the number of children transitioning just recently. I don't know if I can put my hands on it now, but the department has been doing a lot of work to try and assist in the process, understanding that there are ACOs.
They are DCJ, not NGO? I'm asking about DCJ transfers, not NGOs. So just confirming DCJ you're referring to?
Apologies. So our transfers to ACOs. I'll have to come back to you with that figure.
Thank you.
Ms. Higginson.
Thank you. I think that so the cost of the ACAs for 2023-2024 was reported at 86.3 mil in the last budget estimates, but I think I heard you say 143 mil. Is that more of a correct figure of what was, or is it fair to say what the money that you've transferred from that provision to non-ACAs? Is that right? The 143 mil?
It's a cost reduction.
Yeah.
Based on the.
So where is that? So I think my question is specifically whether it's the 86.3 mil or the 143 mil. Where is that money directly now? Where can we trace that money to be spent, other than the Waratah project?
Well, before I hand over to Mr. O'Reilly, who'll be able to give you this in far more detail, I will say that the expenditure on the high-cost emergency arrangements was an overspend. It wasn't money that was budgeted.
Yes.
And so when we came into government, the overspend that we had was 200 million, largely attributable to. Well, actually, it might have ended up being more than that in the first. It kept growing to an eye-watering amount. So it was an overspend on the budget, and it was about 200. It was about 800 million. Over forwards that we inherited as an overspend. So when we don't want to, for a moment, suggest that there is additional money because we've managed to reduce that overspend. But I'll hand over to Mr O'Reilly to explain those figures.
Or, I mean, perhaps we can come back and revisit that detail. I think I understand what you're saying in terms of that. I mean, essentially you're saying you just had to cut those costs.
Well, we had to ensure that we were the money that was being spent on the system was actually going towards better outcomes for children. Like that's the fundamental view we've taken since we came into government, to ensure that taxpayer money is being spent in the best way possible to get the best possible outcomes for children and young people.
Okay, so where is that 143 mil now being spent other than the Waratah? Yeah, go for it, Mr. O'Reilly. I can see you jumping. Yeah.
So we're competing here.
Sorry.
Just to make the point, and the Minister touched on this earlier, that the ITC system had very, very high vacancy rates. It was being underutilised. So that funded part of the system had a 47% vacancy rate in August 2023. That is now 20%. So there was capacity there, and unlike ACA's, constancy of care, home-like environment, and accredited.
Okay, thank you. Just in terms of the reinvestment approach that has been recommended, we saw it, the system review recommended that DCJ create a reinvestment plan that shifts the focus. What steps have been taken to actually develop that plan that everybody can kind of follow along and understand what's happening?
It's a good question, Ms Higginson, and we've recently issued our reform plan. I have a version right here, which steps out the way forward in terms of the work that we are currently doing to stabilise the system, the next steps being to rebuild it, and then finally investing in better outcomes for children and young people. So we've got a lot of work that needs to be done to go through this process. But what we have learnt in the time that we've been in government is that just throwing more money at the problem and into a system that's not efficient or effective, as has been found by numerous oversight bodies, isn't the solution. What we need to do is actually create a system, a world-class system, that actually provides stability, safety for children and young people so that they can thrive.
So in relation to that, and obviously that's good to hear, but so we've now got a bunch of reports that the government's received that demonstrate the money that DCJ is spending in out-of-home care is not resulting in the needs of Aboriginal children being met specifically, and not improving outcomes for them in the short, medium or long term. Is there, or when will, is there a plan, or when will the DCJ take a firm stand and move that money, the DCJ money, out of the system that it's currently in and better invest that could make immediate impacts for First Nations children? So taking money actually out of DCJ and putting it to where it can be better invested.
The early intervention work that you speak of is the goal. It is without question, as I said earlier to Ms McLaren-Jones, the goals that we have is to ensure that there are additional and all the supports in the right place at the right time for the families to keep children safely at home. So there has to be an enormous amount of work done to stabilise the system. As I said, the $800 million overspend that we inherited over the forwards is something that we are trying to control, but not only obviously focused on the budget and working within a budget, but producing better outcomes for kids in the process. So we have got a lot of work underway in terms of the early intervention piece and particularly around family preservation and the work that's done with families who are at risk of coming into the system. We've got a recommissioning process that's been done collaboratively, particularly with Aboriginal stakeholders, for an exceptionally long time. That recommissioning process will see a significant increase in investment for Aboriginal community-controlled organisations to deliver family preservation services. So we're looking at potentially 30% of the share of the funding for family preservation services, potentially more through that recommissioning process, because we understand the importance of exactly the question you're asking, is how do we get more support to Aboriginal children and families earlier.
Has there been progress made on the one of the FIC recommendation 5 about the Aboriginal Quality Assurance Unit and a framework, the accountability framework? Has there been progress made in that field?
On that specifically, I will defer to Mr. O'Reilly, but in terms of the FIC recommendations, I will say that there are obviously there's work still to be done on a number of areas, but that we are working through. We're working through a range of reforms that are being informed by the reports that we've had from the Auditor General's Office, the Ombudsman,
and I know
Office of
we've
Children's
spoken
Guardian.
about it in estimates where you've sort of said, look, that's now potentially aged in some ways and things are informing reforms and updating. I'm not necessarily certain that the ABSEC and the representatives through ABSEC necessarily agree with that. The FIC recommendations that I'm speaking to are the ones that ABSEC and others are holding on to and still want to see. Just on that, in the short bit of time I've got, Minister, New South Wales remains the only state without a Children's Commissioner, and particularly in relation to Aboriginal children and young people. Are you advocating for this? I asked the Premier whether he would consider introducing or establishing, an independent commissioner for First Nations children and young people. He said he'd take it on notice. Is this something you've brought up with him ever? Is it something you're advocating for? And I say it because it is clearly something that First Nations leaders and advocates are calling for.
And you're quite right, they are, and I respect and acknowledge that. And certainly that's the advice that I've received from my Ministerial Aboriginal Partnership Group, as well as other stakeholders, Aboriginal stakeholders across the state. The conversation around the Commissioner in New South Wales, a Commissioner role in New South Wales at this point, is being had with the Commonwealth in terms of the agreement across all states and territories in relation to the minimum requirements about what role would an Aboriginal Commissioner play, and so there are ongoing conversations and attempts to land those and agree.
Are you committed to having one?
On those minimum requirements.
Are you committed to having one?
We are working through those minimum requirements and looking to see what else is happening across every state and territory in terms of their commissioner. And whilst you said there are other states and territories with commissioners established, they are all different forms. There are some that are not legislated. There are some that are. There are some that it just happens to be that there is an Aboriginal person sitting in that role. So across the country there are different forms of it. I'm actively meeting with all of the Aboriginal commissioners across the country in the coming months, and in that process already to understand what we might be looking towards.
But are you as Minister, from where you sit, through the lens that you're looking at and the advocacy you're receiving, are you advocating for New South Wales to have a First Nations children and young person commissioner?
It is a conversation that I'm continuing to have in the Commonwealth space and across other states and territories, and the conversation will continue.
Do you think that there's scope to have an interim position, even if it's not, can't believe I'm going to say this, but the idea of, the perfect not getting in the way of the good, but quite seriously in terms of, this is something that has been called for. It's what First Nations advocates in this space, families, leaders, that's what they're asking for. What benefit do you see in not moving forward with this work now and waiting?
Right now, we have got a system that's in crisis, and we are trying to manage that. That is the focus of our work, and the focus has been in the worst area, and as I've already discussed today, removing children from hotels and motels, and that included a number of Aboriginal children and young people. There has been significant work across all areas impacting Aboriginal children and families. I'll continue committed to doing that work in partnership with Aboriginal stakeholders, with the oversight of the Ministerial Aboriginal Partnership Group, the Aboriginal Leadership Group, and stakeholders across the state. I will continue to work with them on delivering meaningful outcomes for them and their families.
But if First Nations leaders, advocates in this space are saying a commissioner is a place, and they have been saying it now for many years, can you just tell the committee now to what extent are you committed to doing that with First Nations leaders and for First Nations leaders now?
What I'm committed to is delivering meaningful outcomes for Aboriginal children and families across the state.
But does that include establishing a commissioner?
It depends. There's a lot of moving parts at the moment in the system. We've got reform underway. We need to ensure that anything that
so perhaps, Minister, can I ask, do you see what reasons to not establish a commissioner are you looking at this point?
Well, because there are significant complexities like all of these things, Ms Higginson, because there are the minimum requirements as they are currently, the latest version that's been circulated currently straddles partly the roles of the Ombudsman, of the Office of Children's Guardian, of the Advocate in Children and Young People. We've got other oversight bodies that already have these responsibilities. It would take legislative change. It would take significant reshaping of oversight bodies that are already well established. So it is a complex conversation to be had, but one that I'm willing to keep having.
I think that I think that people out there are really, really looking for you to make that commitment, that that's what you're working towards. Not just that we're continuing to analyse it, but that, with the greatest respect to everybody working in this field, your government has established an independent commission and commissioner for biosecurity, for agriculture, and right now the role of an independent commission overseeing something as important as First Nations children and young people in the out-of-home care system and trying to prevent that from happening and children staying with families. Those people on the front line are just asking for the establishment of an independent commission, and they want to know that you've got their advocacy in all of the right places for that to happen. The Premier said to me in budget estimates whenever that was, that he would take that on notice. Surely he will talk to you about, or his people will talk to your people about what is happening. I honestly don't think it is in anyone's best interest if we just come back with we're still looking at it. I think people are just looking for a commitment. Are you committed to the establishment of that, or is it not a priority for you and your government?
It is an absolute priority for our government to reduce the overrepresentation of Aboriginal children and young people in the out-of-home care system. And we want to ensure that the steps that we are taking and the efforts that we are placing and the resources that we are putting into place are going to achieve that goal. So those are the conversations we are having in terms of prioritising the work that's currently in front of us to ensure safety and stability for children and families, children and young people in the out-of-home care system, and as I said, trying to have the resources placed sooner so families can stay safely together. There are currently oversight bodies for all children in the system, but I acknowledge.
But I think the point is they're just not actual First Nations dedicated bodies. These are just bodies across the system that look at all matters. Given the over-representation of First Nations people and children and young people in this system, this is one of the things that leaders and advocates have been asking for. And from where I see, the ask or the advocacy is actually escalating right now. Is that something you would agree with?
Well, not necessarily, but certainly we've had the conversation in the Ministerial Aboriginal Partnership Group. It will be a continuing conversation with them. But even in your question, and with all respect to Ms Higginson, the question changed from commission to commissioner. The FIC recommendations recommended a commission. In the Commonwealth conversations around the minimum requirements, it's a commissioner. There is still, and there's still a lack of clarity around what the role ought to be, and how we're going to, if we proceed down that path, what best vehicle there is to ensure that Aboriginal children and young people have that oversight in the system.
So in terms of the work you are doing and looking at Commonwealth and getting advice, what sort of timeline do you have to be able to make clear to all those advocates that have been asking for this for many, many years what your government's position will be on it? What's that time frame?
The latest version of the the minimum requirements are for discussion at the next Community Services Ministers meeting, which is in a matter of weeks, as I understand. Yes, so it's on the agenda for the 28th of March.
Thank you.
So that's where energies are being focused at the moment.
Thank you. In relation to the Aboriginal Authority for Restoring Children, which I understand came very much from Dr. Newton, just would like, whilst any commitment to that authority would be significant, what commitment has your government actually made to the Aboriginal Authority for Restoring Children in financial terms?
Well, the commitment that we made to an Aboriginal restoration task force came from the Aboriginal Family and Wellbeing Forum that I held in August 2023.
Yep.
So that was one of the commitments, one of 9 commitments I made following that powerful stakeholder forum. The progress on that particular commitment has been significant, and it has, as you said, been led by Dr. Sorry,
yep.
I want to make sure my titles are correct. Dr. B.J. Newton, and the vehicle for a restoration task force is still for consideration. There is a development of a business plan. We're not in a position to be talking about funding for something yet when we don't know what the business case looks like. But last. And I know that the department is working exceptionally closely with Dr. Newton on developing the business case, so that then we can work out next steps.
Do you want to keep going?
Split it 50-50.
Yeah, keep going.
So we'll go.
Split it,
Just finally then, so given it has been over a year since the government announced the commitment to expanding that restoration work, what other work is being undertaken by DCJ to review the circumstances of Aboriginal young people on long-term orders and the possibility of restoration to their families, and how is this being done with ACCOs directly?
I know that we've got a lot more work to do in terms of our focus on restoration as a department. There are pockets of good practice. I believe that was the expression in the system review, pockets of good practice across the state in different areas. And I'm aware of a DCJ-led restoration task force in southwest Sydney. The work is going well, and so there are opportunities for us, and we take them every time, wherever we can, to do the work ourselves and be the system stewards that we ought to be.
But is it the case, Minister, that the rates of restoration are dropping still, or are we seeing a change?
Well, at this stage, the restoration rates are still dropping, and we need to be doing a lot better on ensuring that the work is being done where children can be restored to families, and they ought to be.
So are you still committed to the Aboriginal Authority for Restoring Children? Is that still the commitment?
We're committed to the restoration, standing up a restoration task force.
Okay.
To help us drive the restoration of Aboriginal children where possible.
Okay, and so it might be something to take on notice, but how many Aboriginal children in the out-of-home care system have a case plan goal of restoration? I can take that up with Mr. O'Reilly or Mr.
That will be
Tipple,
it. We'll take it on notice and hopefully give you the answer this afternoon.
Okay, thank you.
Thank you.
No,
I've got 1 minute. Just wanted to just ask about what preparation was done by the department in the lead up to the ex-tropical cyclone.
Sorry, you're looking at Mr. Tipple. I was.
I thought he was going to pull out a note.
There is this. I've certainly been
particularly around disability supports, because that is one. Following all disasters, we know that people with disability have a lot more challenges in accessing particularly emergency supports, evacuation centres and so on. I was just interested to know if there was any preparation work done in the lead up to this one.
It certainly has been a lot of, well prior to we ever heard of now ex-Cyclone Alfred, there was a lot of work being done in terms of our response to natural disasters when it comes to people with disability and ensuring that they have access to the information that they need at a time when they need it most. So as I understand, the Hazards Near Me app has now been made accessible to ensure that people with disability can access the information easily that everybody else has been able to access. And we are well aware of the need to ensure that evacuation centres have got are as accessible as possible to ensure that people with disability can gain the benefit of those services as well. And I've certainly been, as I mentioned right at the very beginning, aware that there has been a number of DCJ staff that have that are now helping in evacuation centres across the north of the state, and who are all very alive to the particular needs of people with disability, and that's why they are the best placed people to be in these centres at this time.
Thank you.
Okay, questions from government.
Thanks, Chair. Just one from me. In relation to children and young people leaving alternative care arrangements, can the Minister talk us through where those children have been placed?
Thank you, Ms Savall. This is the answer that I was hoping to be able to provide to the question that was actually the question by Ms McLaren-Jones. Instead of suggesting somehow that children ought to be in hotels and motels instead of therapeutic placements, I that is certainly not the approach that our government has taken. We have taken enormous steps to ensure that children are removed from alternative care arrangements so that we can ultimately eliminate them as a accommodation type from the system as of the end of this month. So of the 313 children that have exited the ACAs between 1 November 2023 and 19 November 2025, 104 exited to foster or kinship placements. So that's 104 children that were otherwise in hotels, motels, caravan parks with unaccredited providers, costing up to $2 million, and now with 104 and now with foster and kinship care in home-like environments, stable, loving homes. 105 exited to other types of emergency arrangements. 57 exited to intensive therapeutic care. 22 were self-placed, 14 were restored to family. These are 14 children that are now living back with their families safely instead of hotels, motels, caravan parks. And so we've got 5 exited to DCJ residential care and 6 to youth justice. So we've just been doing everything we can across the board to ensure that these children have better, stable placements, safer, stable placements, and can hopefully now be in a position to thrive, because I think everyone in this committee knows that the children that have come into the system in the first place have experienced an enormous amount of trauma even before they get there. For us to have inherited a system where this became the standard in the absence of foster carers, and it became the standard for kids to be placed in these types of arrangements, I just, certainly as Minister, it's not something that I could stomach, and we have been laser focused on changing the system so that in the future these types of arrangements will have no place in them, and these kids have gone, nearly all of them have gone to far better placements.
Okay, thank you, Minister. We now will break if there are no more government questions and return at 11:15. Thank you. Sign's not, oh, there it is, it's on there now. Okay, thank you. We might commence with the opposition, please.
Thank you very much, and welcome everyone back. Just back to the Waratah care cottages. Now, I'm interested to know the number of children that are currently in those 3 properties, and how many. Well, that's the first one.
Currently in the Waratah care cottages, as I said, that there is a number of sibling groups that have come from high cost emergency arrangements, and in terms of numbers, I'm going through. I know that the first one had 4. Go into
Sorry.
the secretary might.
I may be able to help. In November 2024, a sibling group of 3 moved into the first Waratah care cottage. In January 2025, a sibling group of 2 children moved into the second Waratah cottage, with another sibling group of 2 plan to join them in the home soon. And a sibling group of 4 has been identified for the third home, who are currently living in separate high-cost emergency arrangements.
And in relation to that second one you talked about, you said that 2 had gone in, and then there'll be another 2. Are they of the same family or 2 different families?
I don't know I don't think we've got the answer to that.
It's another sibling group, I believe.
Different
separate
sibling
sibling group.
Okay. So with these 5 cottages, they won't always have just the same sibling group. It could have different families.
Correct.
At different times.
Yeah, but the idea with the cottages is for the children in there to not only have a better environment, but also to do any work that we might be able to do to find different placements and longer term placements for them, be that restoration, foster care, guardianship, any of those options are on the table.
So what's the criteria for a sibling group to go into the Waratah cottage versus one of the residential placements that an NGO may offer?
I might hand over to Mr. O'Reilly for that, but I mean, just as a basic, it's purely in terms of having the availability and us, the government, standing up residential homes for the first time to ensure that we've got enough places for siblings to go out of high cost emergency arrangements and to be together. But I'll ask Mr. O'Reilly to give you more detail.
Thank you. Residential care placements are identified on the basis of availability, suitability. Sometimes it's about matching with the children who are already in that particular property. And then what we have done in more recent times is arranged for NGOs working in a particular geographical hub to work together as a system to map vacancies, map children who are waiting, so that we get much more efficient use of vacancies and much better matching. If NGOs operate independently of each other, we don't get those matching opportunities, and so we often have vacancies for an unreasonable amount of time. The DCJ cottages are now part of that mix.
Okay.
So it's really about best fit and timing.
That's fine, thank you. Minister, how do you intend to measure the success of these cottages? So I'm thinking, is there a time limit of how long is expected the young person would stay in that cottage before transitioning to another form of residential care, or is it, aim is obviously foster care, but is there any particular measurements that you've put in place?
Well, I've got to say that having visited 2 of these cottages now, a particular goal has already been achieved and kicked, can I say, by the department in a very short space of time, by standing up these residential homes that are going to provide the therapeutic wraparound support for these children, as opposed to being in hotels and motels with unaccredited providers. So that goal has been kicked, and kicked incredibly well and quickly by the department. So, and visiting these homes, they are homes. They are the people that are going to be providing the support will provide the care and stability for these young people, and including these kids being able to go to a local school, and perhaps for the first time in their lives. So there's
So
there
just
are
on that-
these cottages are allowing us to fulfil our responsibility to the most vulnerable children by ensuring that they've got the best place at this point in time.
So just to clarify, there isn't a time limit. So this is not like transitional anyway. They could be there until they're 18. They could be there for 6 months.
Decisions are going to be
depending on their
made, as always, in the best interests of these children.
need. Have there been any critical incidents in relation to these cottages to date?
Not that I'm aware of.
Just in relation, because it was mentioned before about Sherwood House, has there been any critical instances in the last 4 months in relation to Sherwood House?
Not that I'm aware of, but we can take that on notice.
Yeah.
Yeah,
But you should be advised of any critical incident.
correct, and I'm not aware of any.
Yeah. Are there any children currently missing from Sherwood House?
Again, not that I'm aware of.
In relation to, just to finally, in regards to NGOs, is there any intention by you as a minister to transition any out-of-home care services from NGOs to your department?
The goal, as we have been saying to the sector since we came into government, there is an ambition to reform the system and to get far better outcomes for children and young people. And I don't think there's anyone that would say that that's not necessary, given that the state of the system that we inherited has been examined by a number of oversight bodies, with the Auditor General, the Ombudsman, Advocate for Children and Young People, the Office of Children's Guardian, and going back as well to the the FIC report as well. There is so many reports and recommendations making the case for change, and including the system review that I stood up and we've now got as a reform roadmap. So we are taking our role as system stewards seriously. We need to strengthen our stewardship, and everything is on the table at this point in time.
Can I ask, do you support the NGO sector and their role in out-of-home care?
I will say that there are some really good NGOs doing some amazing work with children and families across the state. So there are other NGOs that I might wish were doing things a little bit differently. So we are wanting to work with those that want to work with us, and we will continue to do so. So there is importantly, we have already begun the work of bringing some parts of the system into government hands. That includes the recruitment of foster carers, the recruitment of family time workers. Now we are also responsible for most of the carer assessments, and obviously the Waratah care cottages that we've already spoken about. We inherited a system where every single oversight body said we did not have enough control over it. And as the minister that actually has parental responsibility for the children in the system, we are ensuring that we become stronger stewards of the system and have control over the system to ensure that those children get much better outcomes.
Thank you. You mentioned just then foster carers, and that is one part that you've brought in. I'm interested to know how much has your department spent on foster carer recruitment, including whether it's staffing, advertising, consultancy work.
The role that we play in terms of foster care recruitment is multifaceted. So every single NGO provider that has the permanency support program funding, they are all able and then funded to recruit foster carers.
Sorry, I'm just clarifying. You were saying before that regarding DCJ, some of foster care recruitment is in-house as well.
Correct.
So I'm interested how much you've spent in your department on foster care recruitment.
Well, when you talk about the department spend on recruitment of foster carers, I'm saying it's multifaceted. Yes, we're doing our own in-house recruitment.
And that's the question
But we
I'm
also
asking.
fund NGOs to do it. We also fund My Forever Family to do it. We also...
I'm aware of that, Minister, and I'm asking how much you have spent, your department has spent on your foster carers. I'm aware of the other areas. I'm interested in your department.
Well, I can take that on notice.
Thank you. And also, if you could then also advise how many new DCJ foster carers have actually been recruited. And that's not the emergency one, it's additional.
Okay, so there's
Two questions. One is how many, well, it's really only one, but how many foster carers has your department recruited with that expense? And I'm happy for you to break it down between emergency and non-emergency.
Okay, and as you know, their foster carers play often more than one role. So our emergency foster carers may well be the longer term foster carers, and the 211 emergency foster carers may well be some of the longer term foster carers as well. So we can provide
Just
a
to make
breakdown
it simple,
to you.
interested to know how much you've spent on foster carer recruitment within your department and what the end product's been.
And
1, 100, 10, 50, whatever the number is.
well, I can, as I've said already, the recruitment of 211 emergency foster carers by us so far has seen 971 children.
And as I said, Minister, I'm interested in the
given safe
additional carers. Now, Minister, there were, obviously we know the IPART inquiry is going on, and we've also seen in some of the hearings that foster carers have raised concerns around payment. Particularly with cost of living pressures, but also because of the complexities some of these young people that they're caring for have. Is there a priority for your government to provide additional funding support for foster carers, particularly those looking after young people with very complex needs, so they don't have to go into the high-cost placements, the residential care models?
There is an enormous amount of work that we need to do to support foster carers more. And the having met with so many across the state, it's critical because they are the very foundations of the entire system, and I continue to be amazed by how they have felt treated, how they have felt with the treatment in the system that we inherited. So.
Minister, with all due respect, these are the same lines you give every estimates. I'm actually interested specifically what you're actually doing and whether or not you'll be committing to provide that support. I also refer to a recommendation from the audit report that said we need to train foster carers to be able to support young people with complex needs. Have you done that? That is something that probably doesn't require a lot of money. Is that something you've implemented?
With all due respect, Ms McLaren-Jones, there is a lot of work underway, and the system review has made it very clear, and we have made it about the importance of ensuring that there is additional supports for carers. And the IPART review that you've referred to, I'm sure it is looking not just at carer allowances, but additional supports that ought to be provided to carers, and we are developing a carer strategy. We are also seeking to make the system more accountable and transparent for them in the roles, the critical roles that they play in caring for vulnerable children and young people.
We might move to disability housing properties, and that's something I ask at each estimates. Interested to know what the number of properties that are currently in DCJ.
I believe that there are currently 800, but it might be 804.
Yes, that's okay. That was the number last time. And in relation to the supplementary question, I got a further breakdown that said 721 properties were occupied for people with disability accommodation and services, and that the remaining properties 40 were allocated for out-of-home care, 10 currently used for transitional housing, 1 currently used to deliver philanthropic funded program, and 2 are being privately rented. Could you explain the transitional housing? Is that for people with disability or in out-of-home care?
That's under the program. What we have ensured is with any available stock that we've got, it is being used for government priorities. And right now, given that there's a housing and homelessness crisis, we did not want to see any of our housing sitting idle in that context. So we've ensured that when residents choose to leave the homes that they have been in, that stock is utilised either to help us in our goals in out-of-home care, as you mentioned, to find additional placements for children and young people, or for temporary accommodation, which is under the responsibility of Minister Rose Jackson.
So it can assume that those 10 properties and the 2 privately rented ones are not for people with disability.
That I would have to take on notice.
Is it a policy requirement that all those properties should be used and allocated to people with disability?
The policy requirement is ensuring that we are addressing the needs of the community where those properties are, and ensuring that we are delivering on our priorities as a government to help address the housing and homelessness crisis, or help address the crisis that we inherited in the out-of-home care system.
Minister, I'll just refer to a question that was asked of Ms Campbell back in November 2023 in regards to whether or not the policy is that the properties should be used for people with disability, and the answer was yes.
Well, where there is a need for people with disability for accommodation of that type, of course, we will ensure that that's where they go, but that those properties are utilised. But in a setting where we have where we know that there are people facing homelessness daily and there is a vacant property that's not being used by someone with disability, then we will make sure that it's being utilised. And I've got to say that when we came into government, we inherited a number of vacant properties in the stock that that was part of the disability housing stock. They were vacant, like the Stockton Centre, where we have now turned 7 of those homes into meanwhile use for families facing homelessness in the Hunter. So we have stopped these properties sitting idle and now being utilised.
Minister, just in relation to the Stockton, is that being used for people with disability?
They are being used. As opposed to sitting idle as they did under your government when you closed it and you said it wasn't possible to turn it around into anything else and for housing for homelessness. Your government said in budget estimates that was not possible. We have made it possible, and we've now got 7 homes stood up on the Stockton Centre side.
Are you aware, Minister?
Deputy Chair, my point of order is just we've had a number of cases now where a question's being asked, the Minister's partway through an answer, and then another question's being asked by the honourable member that runs over the top of the Minister.
The member's taken the point of order. Carry on. Thank you.
Minister, are you aware that the current wait list for public housing and social housing, there is over 1,000 people waiting for social housing with disability, and that's an increase of 1,000 people in the last 12 months. Are you aware of that?
I'm aware that there is extraordinary pressure on the social housing availability for people, and particularly it's acute for people with disability. And that is because, like in an area like mine, there was no investment in social housing for over a decade.
But Minister,
and we, as a government, are doing what needs to be done
properties
to
that are
deliver
meant to be
social
allocated
housing
for people with disability. Minister, these are properties that are meant to be allocated for people with disability. There's a waiting list for them, and they're not being utilised.
Chair, my point of order goes to the level of interruptions that we're now seeing, the same issue. I just ask that you remind the Honourable Natasha McLaren-Jones of the responsibility to provide courtesy to witnesses at all times.
Thank you. Courtesy all round. Thank you.
Minister, will you give an undertaking to speak to Minister Jackson about prioritising these properties that are in your portfolio are allocated to people with disability? There are thousands of people waiting for properties, thousands more waiting for modifications. Will you speak to the Minister to ensure that these properties, as they should be required, be allocated to people with disability?
Ms McLaren-Jones, what I will ensure is that we are using every single space that we have available to meet the housing and homelessness crisis faced by people with disability, faced by people without disability, and our historic investment in social housing and accessible housing across the state is in stark contrast to your government's record when it comes to social housing, which has led to this wait list that you speak of.
Minister, these are people with disability who are waiting to get access to public housing. You have housing over 800 in your responsibility, and they're not being allocated to people with disability.
Well, Ms McLaren-Jones, I don't accept that premise of the question. In your opening statement, you said how many of our properties are being used for people with disability, and it is the vast majority. Where people with disability are choosing to move to more suitable and using their choice and control under their NDIS packages to move to more suitable housing, we will utilise housing in the best way possible to meet the government priorities of either helping people who are facing homelessness, whether they have disability or not.
Minister, is it true that these people are not necessarily choosing to move, but because you continue to have a month-by-month contract with these providers and provided insecurity housing, that they're being forced to move out?
No one is being forced to move out. I do not accept that at all. People are choosing. They have SDA packages, SIL packages under the NDIS that gives them the choice and control to move to properties that are more suitable to their needs.
Thank you. Ms Abigail Boyd.
Thank you, Chair, and good morning, Minister.
Good morning, Ms. Boyd.
You will have seen the recent media reporting of a really appalling treatment of people with disability living in group homes. And it's shocking but not surprising, because we do know from the Disability Royal Commission, we've heard about this as being a huge issue. It's been 8 months since New South Wales responded to the DRC's recommendations for phasing out group homes and putting in place transition pathways. What are you doing to build strong transition pathways for people so that they don't have to be in these group homes?
Can I just say, Ms Boyd, I don't necessarily accept the premise of your question around that group homes aren't always a suitable placement for people with disability. It is, it's an offering that allows choice and control. If we're allowing people with disability to have choice and control, it is around the ability to choose to live in a group home if they so choose. So that's, and there are people with disability who I've met who are in exactly that situation. So I'm not.
But that's not what I said either. Can we just be clear?
Yes.
I didn't say that it was unacceptable for any particular person. What is very clear from the Disability Royal Commission is that there is a need to transition away from these group homes for most people with disability. That option is not being given unless governments work towards it. What are you doing to provide alternatives to group homes?
Well, we are making sure that we have got, that we are increasing the supply of accessible housing in the state with the largest ever investment in social housing, all of which will be accessible. And then that was the first step we took to increase accessible housing supply in the state. And then, of course, we've also ensured that the government architects work around the pattern book. Every single one of those designs will be at a silver level standard.
Yeah.
If not,
I
would
higher. Love to take up the accessible housing requirements, but I just want to focus on the group homes and the ability to transition away. So what we're talking about is creating homes with independent living with tailored support, co-housing, those sorts of models.
Yep.
What is your government doing to transition people, actually provide pathways for people who are in these abusive group homes and allow them to move to something better?
Again, I'm just going to, I respect the intent of the question in terms of, but painting a picture where every group home is abusive, I think is a complete, is an overreach.
That's again not what I said, but we've all seen the media. There is a problem in group homes. There are people who want to move away from group homes, and the Disability Royal Commission recommended we have transition pathways away from group homes. So what are you doing to allow people to make that choice?
And of course, the instances that you speak of and that has been reported recently in terms of abuse in group homes is abhorrent. And there is work, obviously, that needs to be done. But I want to be really clear that as a government, what we do is invest in the NDIS, and the NDIS has, under the as part of their system, the SDA packages and SIL packages, and they are also responsible for the oversight of those arrangements in terms of the Quality and Safeguards Commission.
Yeah, but the Disability Royal Commission put an obligation on state governments to provide transition pathways, working with the Commonwealth. Sure, I understand the Commonwealth has a bit to play in this, but what I'm hearing from you, Minister, is that you're not, it appears that you're not doing anything in terms of actually, if you can't acknowledge there's a problem with group homes, then what are you, like, are you doing anything in order to move people away from these group homes? What are you doing in relation to group homes?
Again, in terms of the way you've put the question, I do acknowledge that there is a problem in some group homes, and there's, as there are in any setting, it can be in an individual setting as well. And the responsibility for oversight of those does sit with the NDIS Quality and Safeguards Commission. In terms of working with the Commonwealth, of course we are doing that in terms of our co-governor, co-funder role with the NDIS is to ensure that the Commonwealth is delivering on its obligations to people with disability with complex needs across the state. You don't get an SDA package or a SIL package unless you have complex needs, and we will work with the Commonwealth on developing and ensuring that people with complex needs have choice and control as they are entitled under the NDIS.
But under the current SDA program, under your government, group homes are continuing to be built as the standard for housing for people with disability. So if there's not an option to do something else because you keep building these group homes, how do you on the one hand say that you've got nothing to do with actually providing other options and at the same time allowing all of these new group homes to be built?
Can you, the group homes that you're referring to, what are you referring to?
Under the SDA.
Which is a Commonwealth NDIS program.
Yeah, but they're being built in New South Wales. So what are you doing to develop a diverse range of inclusive housing options? I mean, we know that you're not implementing the silver minimum accessibility standards because you keep refusing to do that. So what are you doing to allow more independent living, more co-housing?
Our response to the Disability Royal Commission shows our clear commitment to ensuring that there is a diverse range of housing options for people with disability. But and we will work with the Commonwealth on our response to the Disability Royal Commission recommendation, but also ensure that under the NDIS that the Commonwealth is meeting its obligations to the people in the scheme that have funding for SDA and for SIL.
What I'm struggling with here, Minister, is it doesn't seem that you think that the New South Wales government has any role to play here. What did you do when you saw yet more? And I know that you've said there are, perhaps some group homes that don't have these problems, but given the huge number of group homes that are identified during the Disability Royal Commission and continue to come out in the media, what have you done in response to New South Wales group homes where this sort of abuse is going on?
To be clear, our stock, we lease that to SDA providers. SDA providers get their funding from the NDIS. So it is when the state government signed up to the NDIS, it was the responsibility for people with disability, with significant and permanent disability, became that with the NDIS. We take our role as a co-governor, co-funder of the NDIS seriously, and we want to ensure that we've got the best outcomes.
But your role as Minister for Disability goes well beyond funding. It goes to actually advocating for people with disability. And the idea that this sort of horrific abuse can happen in New South Wales to people with disability, and you're sitting there saying, well, it's a Commonwealth responsibility. I'm asking, what have you done as New South Wales Minister for Disability in relation to the abuse happening in these group homes?
We are supporting the Commonwealth's work to bolster the NDIS Quality and Safeguards Commission, which is the oversight and regulatory body for group homes in the state. So the Commonwealth has done in partnership with every state and territory, a significant amount of work to bolster the resources in the NDIS Quality and Safeguards Commission so that they can have greater oversight of what's happening in these homes. I've also recently met with the Fraud Fusion Task Force to understand what it is that we can do as a state to support their work to ensure that the NDIS is delivering what it ought to deliver to people with disabilities.
Okay, let's turn to something easier then. What about when you heard about the abuse being directed at people by the taxi and rideshare industry? What did you do personally in response to that abuse?
Well, there's been a lot of work that's been done on that, and you're right to say how appalling that behaviour is. There's been I've spoken with the Minister for Transport, the former Minister for Transport, and the current Minister for Transport about the reported instances of abuse of people in taxis, and our government has already done work to increase the fines for and penalties for fare-related offences. We've also recently late last year, announced the $15 million emergency package around wheelchair accessible taxis. Part of that $15 million is designed to go to training and education for taxi drivers.
Do you think that the people who are, shoving people roughly in the back of taxis and, treating them, not even securing them, all the rest of it, are going to change their ways because of training?
Well, when we held wheelchair accessible taxi roundtables across the state.
Oh, definitely beneficial, and particularly in that context. But in terms of a response to this particular news, I would have expected something a little bit stronger than that.
Well, we've increased penalties
for
we've also
of people with disability, or for charge fraud,
for refusal, for entry as well. And there's also now the ability, there's stronger safety laws, and it's all been done by the point-to-point commissioner around complying with standards. And we're going to continue to look at other options available to us to strengthen safety for people with disability taking taxis. Unfortunately, we've had a lot of difficulty with the Uber industry and their engagement. But what came clear from the wheelchair accessible taxis that we held around the state, which was with people with disability and taxi operators and taxi drivers themselves, that they were wanting to have more education and understanding about how they can transport people more safely. I take your point that there are going to be rogues in the industry, and we need to make sure that they are called out and that they are pulled out. And so we have got levers now in place to be able to do that.
Can I ask you, sorry, I've lost my train of thought. I will pick that up with the point-to-point commissioner later. Can I just ask you, just final topic? Oh no, actually, sorry, I've remembered now. The thing that strikes me about the group homes and the issues that we've been having in taxi and rideshare industries is, in a lot of these cases, these are restrictive practices being employed as well. And it was interesting to me that the restrictive practices consultation paper that was put out didn't envisage actually covering people in those sorts of situations. It's got a very narrow focus. What was the reason for being so narrow?
Well, as I recall in the restrictive practices paper and the work that's been done on that in consultation with disability stakeholders, it does include conversations around education, health, justice, and as well as other areas. So it's a piece of work that is ongoing, and I'm aware that you've made a submission to that process, which has just closed. Yeah. And it, as you're aware, really complex. also goes hand in hand with the work that we're doing around guardianship and the supported decision making, and so it is very complex, and we will be looking at where restrictive practices are applied and where it's appropriate for us to be applying any changes.
Thank you. Sorry, the final topic. I just wanted to ask you, what are foundational supports?
I'm so glad you asked.
Because no one knows.
I've seen you asking some other people about foundational supports. Some of my colleagues.
No one seems to know.
Well, and how much time do we have?
Only 5 minutes.
It is an enormous opportunity for our state to have additional resourcing going into foundational supports. We are eager for the deal to be landed, and it is. And obviously, we already deliver a lot of foundational supports. They come in our mainstream services in health and education. And
what are they?
There are general foundational supports, targeted foundational supports, and the work that we are now doing is to design foundational supports, all contingent on landing a long-term health deal. And that was always part of the National Cabinet Agreement back in December 2023. So we are trying to land it, and we are doing the design work. Would you like me to tell you what that could be?
I just don't understand how we can have an agreement with the Commonwealth for foundational supports and to understand what that is, and for the Commonwealth to have taken people off the NDIS already on the basis there's going to be these foundational supports, and yet no one can actually tell me what the extent of those foundational supports are. It seems like something that could be easily manipulated for either the Commonwealth or the states to sort of get out of providing some of the supports people already have. I guess the question is, all of the supports that people had under NDIS before the changes, will they be provided by the state? And if so, are they available now for those people who have come off of NDIS already?
Yeah, and it's a good question, and I know that there's a lot of conversation in the disability community about where we're at and what's going on. In the changes that have been made to date are around eligibility, and there's a lot more rule changes to come. But what we have made sure in this process is that we continue to have a say in those rule changes and the timing of those rule changes. Because if people are coming out of the system, we need to ensure that there's a system outside that they get the supports and services that they need. So right now, there are obviously mainstream services that the state government delivers, and so they are part of a foundational support system already. But there is a lot of work to do to design an ecosystem that sits outside the NDIS, where people get the services that they need when they need them, and the initial cohort is agreed that it will be 0 to 9 year olds. So it's an exciting opportunity for our state to ensure that young children are getting the services and supports that they need when there's, say, a developmental delay, and it's prior to a diagnosis. Like at the moment, there are some some families that can't access a diagnosis for a child. To get an appointment with a paediatrician can take 2 years.
Yes, I know.
So we want the services. We want children to be seen early. We want children to access the supports they need early.
But for a child who's just come off of NDIS at the beginning of this year, do they have the foundational supports they need right now?
If you've got an example of someone that's been taken off the NDIS that ought to be in it, I'm keen to hear it, because I'm hearing anecdotally from people in the community that there are instances of people coming off the system, if you've got examples, I'm really keen to see them, because what we don't want to see is that anyone who ought to be in the system that the NDIS was designed to serve coming out of it. So we are, at this point, we are, like I say, open to any examples that you've got, because then I'll be raising it with the NDIS, because it should not be happening whilst we do not have the foundational support system set up outside.
I will send you some reps. Thank you.
Please do.
Sorry, I
it's no
hogged
problem.
the time.
Minister, just going back to where you referred to the deployment of the frontline caseworkers to the front line in relation to the tragic infant death some years ago now. Of the initial 77 casework specialist staff that were redeployed, I understand that there's only 44 of those left now. Is that your understanding? And if that's the case, what's happened there?
Ms Higginson, yeah, the decision to deploy our specialist, our casework specialists to the front line was so that we could help tackle the caseworker vacancies and ensure that more children are being seen. The casework specialists are part of the Office of Senior Practitioner. Not all of the casework specialists have been are in the frontline roles and carrying casework. Some of them are sitting with the HCEA task force. Some of them have other specific roles in other divisions and still undertaking those tasks instead of carrying a caseload.
I'll come back to it. Thank you. Over to you.
Thank you. Just, I might just go back to the disability properties. In relation to the 40 that are currently used for out-of-home care, are 5 of those the Waratah cottages?
I will just have to check. I know that certainly the Waratah care cottages have come from our disability housing portfolio and have been repurposed to serve the new purpose of supporting these young children.
Is it your intention that the remaining 35 will become residential group homes run by the department?
We don't run any group homes. I'm sorry. I don't understand the question.
Is it your intention that the remaining 35 will become more cottages?
At this stage, no. Those other ones that you refer to are being used for a purpose already with out-of-home care to provide safe, stable placements for children.
And who's running those cottages or
they
homes?
would be with various NGO providers.
And they're all for young people with disability in out-of-home care?
They are for they are for children in out-of-home care.
Okay. And just the 2 properties that are currently for private rental.
Yes, you asked me about those before and I said I would take that on notice.
Oh, okay, sorry. Just moving on to the Ageing and Disability Commissioner. Given the Commission has experienced an increase in heavy demand for services, we saw a 24% increase in calls to the abuse hotline, or helpline, sorry, and a 13% increase in reports since it commenced, and this is based on their annual report from which was put out late last year. Will you be committing to increase their funding?
The Ageing and Disability Commission plays such an extraordinarily important role and they do their work extraordinarily well. And what we have ensured as a government is that they have the resources they need to do their important work.
Minister, I'm not sure if you would have seen, but the landing page for the ADC has a warning. As soon as you open it up, it has a warning, and the warning says, Abuse Helpline is currently experiencing high demand and the response time for non-urgent reports is 4 weeks. What are you doing to support them to clear that backlog?
We are supporting the ADC by ensuring that they have the resources that they need to do their work. It's important work and they are continuing to do it with the resources that they need.
Do you know how many reports were not responded to in that 4-week period?
No, I don't.
Have you asked?
I have conversations regularly with the acting commissioner. But as you would be aware, there's recently been a new commissioner appointed. Mr. Jeffrey Smith starts on the 21st of April. I will certainly be having a conversation with him about where things are at with the ADC when he comes on board.
And in your previous meetings with the acting commissioner, has she at any stage said that they're at capacity, that staff need additional support or resources?
She has certainly indicated that there is an increase in the numbers of calls that they are receiving, but that they have the resources that they need to do the important work they do.
Are you aware that from October to December last year, and this is again based on their report, it revealed that 5.1% of reports to the ADC were from Aboriginal adults with disability or older persons. This was higher than the previous quarter of 3.9 and the yearly average of 2023-24, which indicated 3.7. I'm interested to know what targeted programs your government has implemented to support people with disability in the Aboriginal community.
And whilst it seems a little bit odd, it is good news that there is an increase in the use of and the reporting to the ADC by Aboriginal stakeholders. It's starting to reflect the level of disability in the Aboriginal community. So we've got, as you would be well aware, the Disability Royal Commission in Volume 9 had a raft of recommendations in relation to increasing supports and services for Aboriginal families and people with disability. We, as part of our response to the Disability Royal Commission, we held a standalone consultation with the First Peoples Disability Network to ensure that we were responding in accordance with their wishes as well and taking on board the issues that they're experiencing. So we will continue to do the work that we need to do to support Aboriginal people with disability, whilst noting that anyone with a disability that is significant and permanent will and should get support from the NDIS. And again, there has been pleasing increase in the number of Aboriginal people who have been seeking support from the NDIS from previous years. So there's been an increase on that front as well. So those with significant and permanent disability ought to be getting support under the NDIS. We contribute $3.96 million to the NDIS as a state just this year alone, and we want to ensure that it is delivering for the people with disability in this state, whether they are Aboriginal or non-Aboriginal.
Thank you, Minister. Are you aware that the most reported alleged abuse is psychological abuse of 39.7%, neglect 22.1%, and financial abuse 21.1%. Again, I ask what specifically you're doing as a government to address this.
Well, the Ageing and Disability Commission is obviously an organisation that has important statutory functions and is funded by the government to support exactly these scenarios. If it is not within the
Sorry, are you saying it's their job to do work around prevention of psychological abuse, neglect and financial abuse of a person with disability? Or
No,
is
I'm
it
not.
your job as the Minister?
I am not saying. I am saying that it's the job of the Ageing and Disability Commission to receive these complaints so that we can understand what's happening in communities and to ensure that they are getting the supports and services that they need.
And that was my question. So I'll ask you, in relation to the Hunter, it has one of the highest level of reports, 16.3%, and South Western Sydney, 11.6%. Again, I ask you what specifically you're doing to support people with disability in these communities, particularly around whether it's psychological abuse, neglect or financial abuse.
Well, there's what we are doing across government is ensuring that we have got mainstream services that are accessible and inclusive and are able to respond to issues that are faced by members of the community. So we've got enormous amounts of work in terms of accessibility and inclusion across in transport, in education, in all of our services, to make them more inclusive and accessible for people with disability across the state.
But it's obviously not working because we're seeing an increase. In fact, there's been reports, in relation to the reports that have come in, the ADC has advised that because of the high volume, it's taking more than 30 days to close cases. This has been an increase over around 20% over the last 12 months. The ADC in their report actually says due to the significant increase, there's also psychological risk to staff at the ADC associated with the high number of reports that they're dealing with, and particularly the complexity of cases. Again, I ask you what you're doing to support the ADC and their staff.
Well, we will continue to provide them with the funding that they need to do the important work that they do, and I look forward to meeting the new Commissioner when he starts on the 21st of April. Of course, he's going to be the first Commissioner, Ageing and Disability Commissioner in New South Wales who has a disability himself. And I just wanted to correct the record that on the ADC landing page, it does not say that you will be responded to in 4 weeks, as you said, that they will hear that people making the report will hear back from us within 4 weeks. And that's just being open and transparent and very clear about the what people should expect when making a report to the ADC.
And I'll be asking the Acting Commissioner this afternoon about the length of time that it takes. Minister, I might move towards education plans, again something I ask about quite often. Estimates. The Ombudsman's report, recommendation 5, actually said that DCJ should report publicly on the number of school-aged children who are in out-of-home care. I asked you last estimates. You advised last year was 70% of young people in out-of-home care were enrolled. What are the figures for this year?
I'm really glad you asked this question, Ms McLaren-Jones, because it's something that when I came in as Minister, I was shocked to see that we did not have this data being shared from education to out-of-home care, because it is one of the critical ways to ensure children thrive, is to ensure that they are engaging with their schooling and furthering their education. So current figures in terms of access to education, I might hand to Ms Dean, Mr O'Reilly has it in front of him in terms of the exact figures.
Yeah, in the 2023 school year there were 12,215 school-aged children under PR to the Minister, and more than 70.5% of those were enrolled in government schools.
That was the figure I gave you. I'm interested in this year's figure.
Oh, okay. I beg your pardon.
I can just add to that, it's not due until February. We get the data, I think, last month, so our team in DCJ are just analysing those results at the moment.
Perfect. Then happy for you to take that figure on notice. And this would probably be the same, but how many children have education plans in place that are currently in out-of-home care?
The expectation is every single child in out-of-home care is engaging with some form of schooling.
I'm aware of that, but I'm interested in the number of young people in care that have an education plan. I would expect that's data that the department should be sharing.
We'll come back to you on that.
Yeah, thank you. I refer to a supplementary question number 49 from Budget Estimates, and this is actually from 2023, in relation to the exits from out-of-home care to homelessness services. I also asked about it last year and was advised that you're working towards, or the departments are working towards, transparency. I'm interested to know what's been done in relation to better oversight of young people who have left out-of-home care that are going into homelessness, particularly the ones that are still under the age of 18.
Well, it's a really important cohort to ensure that we have got visibility on and caring for. It is also one that it's very difficult to have that visibility. But I might hand to Ms Dean in terms of the progress that we've made in terms of ensuring that those children have the supports that they need.
I'm interested to know, do you have that data? Is that being, because I'm happy this afternoon to talk more broadly, but whether or not you're actually getting that data from Minister Jackson in relation to it, or is anyone actually monitoring the number of young people presenting to SHSs that are under the age of 18 that have come from out-of-home care?
We, if I can assist, Minister, my recollection is this was a substitute report by the Ombudsman.
Correct.
And there was a protocol for data collection, certainly in respect of specialist homelessness services,
Correct.
which was instituted. I could take on notice the more granular response, but certainly a data capture protocol was implemented, and we can come back to you on that.
Thank you very much.
I can just add
And
to
also,
that. I can just add to that. There has been a dashboard that's been developed. We've actually consulted with the New South Wales Ombudsman. It's being led by Homes New South Wales, but there's obviously an intersection with Child and Family. And in terms of the data, it's likely to be released in April, May this year.
perfect. And the other thing was just in relation to the mandatory arrangements for SHSs to report young people who are obviously under 18 to DCJ, or that they've got a minor that's presenting to an SHS.
Sorry, what's the question?
In regards to reporting by an SHS or any youth service that a young person is presenting that is under the age of 18.
I believe that is a component of what we've just covered in responding to the previous question, but we might take that on notice.
Yeah, I can probably add to that. I've just got the most recent data. So it's actually improved from last year. In terms of children under the parental responsibility of the minister, there were 66 children that fell into that particular category. The previous year it was 75. And in terms of where those children are coming from, the largest proportion are from relative and kinship care.
Yeah.
And if there are issues in those SHS services where NGOs are concerned about those children and young people under parental responsibility, they get escalated to the Deputy Secretary in the Child Protection and Permanency area.
Great, thank you very much. I might just move to caseworker vacancy numbers, which I understand is currently sitting at 9%. In relation to the data of Roche reports, the latest quarterly data, which was last year, is 116,275. For the same quarter in 2023, it was 113,425. Minister, it seems that we still have a challenge in relation to caseworker vacancies, and Roche reports are going up.
Yes, Ms McLaren-Jones, as Minister, I do have ongoing concern and about the number of children being seen. This place...
Can we stop the clock? Or?
This place never stops surprising, does it? Mm-hmm. When we've got bagpipes going on outside. In terms of the caseworker vacancies, I'm pleased. Whilst 9% is not where we want to be still, it is a reduction from the peak that we saw in September 2023 of 12%. So we are heading in the right direction when it comes to caseworker vacancies, and there's an enormous amount of work that we are doing, including recruiting roughly 500 new caseworkers every single year. The work is being done both in terms of recruitment and in terms of retention, and trying to ensure that caseworkers and the incredibly important role that they play is valued in our system, because they, as I said before, don't feel that they have been for a long, long time. So
just in relation to that, I did ask you last estimates, particularly around the far west, Murrumbidgee, Western New South Wales, that had a vacancy rate that 12 months ago was, I think, 1%. That's gone to a staggering level of 10%. I asked what you were doing then. I want to know now, we're another 5 months on, and that vacancy rate is still there. What is being done, particularly around the far west and Murrumbidgee?
Well, I'm trying to answer your question, Ms McLaren-Jones, in terms of the work that we are doing to support caseworkers in the incredibly important role that they do in keeping children safe. So we have lifted the wages cap that your government imposed on all public service workers.
But it doesn't seem to be turning the case numbers around.
And as I've said, the caseworker vacancy rate is heading in the right direction. We've also seen a reduction in or an improvement in retention as well, an improvement from, it's fallen to 15.4%.
in 23-24 from the previous year, where it was sitting at 17.4%. So on both of those measures, we are moving in the right direction, but it's not to say we don't have an enormous amount of work to do to correct what was happening in the past. So we have increased their salaries, given them a historic pay rise, which is 8% over the past 2 years. We've got new caseworkers now receiving an additional pay bump of $8,200. We've got a mentoring and leadership program being developed and co-designed by caseworkers to ensure that we're not just talking pay and conditions, that we want to ensure that they have the pathways to succeed in their roles and to move in other directions as well.
Thank you, Minister. We look forward to seeing the next data. In response to a question notice at the last estimates, it was provided that in 2022-23 year, 137,129 children had ROSH reports closed due to competing priorities. That was from the March 24 estimates. Can you provide the updated data for now?
It's not at my fingertips, but we can provide it to you either later or we'll take it on notice.
Could you also advise how many child protection cases are currently unallocated?
I don't exactly know what you mean. Can you be more precise in what you are asking for?
A case that is reported a child at risk has not been allocated to a caseworker because their workload is too high and they're unable to take any more cases.
Is that something that...
It's the same as the closed competing priorities. So
it's the same question. And I will say, in terms of...
Sorry, it's just called different things. Closed for completing priorities. Yeah. You're saying that when a case is not allocated, it is because it's been closed off because of competing priorities.
What I'd say in response to that question is that that number fluctuates. So you might have a number of ROSH reports that move out of the helpline across the state into various offices today. Some of those cases will be allocated tomorrow. Some might be allocated at a later date. Some might be closed. Yep. So in relation to providing you with a number...
specifically interested in the ones that are closed because of competing priorities.
But if you... I think what Ms Dean's trying to say is that it is fluctuating. If we want a point in time, I think that would be virtually...
happy for you to choose a date of 28th of February if that makes it easier. But I'm interested to know specifically, as of the 28th of February or the 1st of January, how many cases were closed because of competing priorities?
Well, and can I just say, what we have done as a government since coming into this role is be as open, honest and transparent as we can, and we have got more on the public dashboard than has ever been before, and that includes a clear statement of the cases that we have not been able to allocate. So it's a new way of operating. We want to be as transparent and open and honest about the system as possible. If we can get you what you are after, we will. But I'm not sure that that's. I'm still not clear what exactly
Minister,
is being asked of us.
You provided that information at the last budget estimate, so I assume your department will be able to provide it again.
Okay.
Thank you. Minister, how many times have you now met with the MAP group members?
I have met with the MAP group members a number of times, just as recently as a fortnight ago. It was the first one for this year. I think we're up to 9 meetings.
Great.
Yeah.
9.
Thank you, Ms Jarrett.
Thank you. What are the priorities for reform identified by MAP group members and the ones agreed with your office?
Well, there's a number of priorities and across the work that we're doing with the MAP group, and every single meeting I will go through and report back on the 9 priorities that came from the Aboriginal Child and Family Wellbeing Forum from August 2023, and provide the progress on every single one of those. Then the MAP group members themselves undertook a strategic workshop last year and identified their key priorities as Aboriginal community decision making.
Yep.
Strong families, including reducing the use of emergency removal powers. bring children home, including through increased focus on restoration, and to bolster ACCOs through investment. So those 4 areas are the high-level priority areas for the group. And certainly the work that Mr O'Reilly has been doing in terms of mapping the reform work and identifying the work that he's doing and where it falls into these priorities has been really helpful.
And so so it's fair to say they're also your priorities, those 4 key priorities of the MAP group?
Indeed, and we are working together to work through a range of reforms that will see meaningful outcomes for Aboriginal children and families.
Thank you. One of the things announced at the Reform Forum in August 2023 was the safeguarding decision-making for Aboriginal children. How many SDMAC panels have been convened since the last time you provided numbers to this committee, and how many Aboriginal and Torres Strait Islander children did that represent?
In terms of exact numbers, Ms Jarrett may be able to provide them to you, but there's enormous amounts of work going to ensuring we've got the SIDMAC panels that you reference, but also ACCMS, which is another group that where community panels of Aboriginal stakeholders can guide decision making of DCJ as well. ABSEC has been funded by us to work on standing up ACCMS across the state, whilst also we've been doing the SIDMAC panels as well. What we want to ensure, though, in all of this work is that we have the right people around the table to be able to have the conversations, DCJ, community representation, community representatives, NGOs, providers around the table to have the conversations about who can support this child or family at this point in time. And I've got to say, when I went to Moree earlier this year, I saw a wonderful example of that happening, where we had community representatives. We had a wonderful Jenny Swan from GMAR. We had NGOs, ACCOs, DCJ, all having conversations about vulnerable children and about who is best placed in that community to provide the support that that child needs. And so for me, it was really heartening to see that community and the DCJ office there ensuring that their decision making was being done in partnership with community. That's where we need to be getting across the state, and we can provide more detail to you in terms of.
And I can talk with Ms Jarrett after we can come back to it if that's okay. No problem. One of the and thank you. One of the from the questions of on notice from 4 September at the last hearing. In relation to how many children were recommended by the panel to enter care versus the number that were returned to parents. We got 337 Aboriginal children were recommended to enter care and only 161 were returned to family. Where did the other 344 of the 842 Aboriginal children discussed at the MAC panels go? Is that something, like what is happening in terms of the number of these children?
That is a good question, Ms Hinson, and we will endeavour to answer that this afternoon or take it on notice.
All right, thank you very much. Given one of the priority reforms under Closing the Gap is strengthening and growing the ACCO sector, and we've been talking about this, has DCJ given consideration to how they might encourage the transfer of Aboriginal staff of DCJ to the ACCO sector, consistent with the transfer of funds, resources and control envisioned by the transformed system? Is that a conversation or something you've given consideration to, Minister?
Well, certainly workforce issues are a critical part of the conversation across our entire sector, both in terms of department resourcing as well as NGO resourcing, and obviously ACOs. So we, as part of the transition, there's certainly conversations around workforce in NGOs and ACOs and whether or not there's a willingness, and I believe there has been some transfer of staff from some NGOs to ACOs to support transition.
So, as in on a temporary basis, is that what you mean, or?
And Ms. Jarrett might even correct me on this, but that particular question around our staff moving to ACOs has never been raised with me before.
Okay, thank you. As part of re-entering the market as a foster care provider and undertaking care assessment authorisations, do you propose to also adopt the recommendation of the system review that DCJ retain case management of placements where matters are before the court? And I'm asking this in the context of any consultation with the peaks and the ACOs about this, given the concerns that the New South Wales Audit Office and DCJ, that the Audit Office raised, that it's not effectively safeguarding the rights of Aboriginal children.
Well, I can say that the system reform, as I've said, as soon as it landed, is providing our roadmap for reform. So yes, the recommendations in that are guiding our reform decisions. So there is a lot of work to be done within our own system, but I've got to say, this was one of the there's lots of things that vexed me when I became a minister. This minister responsible for out of home care and the child protection system, but the idea that we have children in the care of NGOs that are still going through the court process and before they've got final orders, and we've got caseworkers who work with the children in an NGO, and we've got a DCJ, somebody from representing the department in the courtroom that doesn't necessarily have that connection to that child and know exactly what's going on. It makes it a very difficult court process when we don't have direct responsibility and controls and understanding of exactly where that child is at. And we have a responsibility to the court, we have a responsibility to the child to make sure that we are representing their interests in the best way possible. And when they aren't with us, and when we don't have that direct line of communication and responsibility for that child, I find that I have always found that quite troubling, and so I welcomed the recommendation from the system review.
So it is your intention then that DCJ will retain case management of the placements?
Well, as I said,
when they're before the courts.
We are using the system review as the roadmap, and the recommendations in it we are following. Okay. But everything is on the table. How we get there, and the conversations we need to have a lot more conversations with with NGOs, peaks, providers. Those conversations are happening regularly. I've got to say, I meet with every single peak regularly, and their members, and I've now got an arrangement where I'm meeting with their members twice a year, and hearing from them directly about where things are at for them.
Thank you. What intensive and professional foster carer models have been introduced since you've taken over? Oops, there's the bagpipes again.
We're working on our own delivery of that potential intensive care models. That's still in development at the moment.
Thank you. So is New South Wales, is the government providing residential care to any Aboriginal children now in New South Wales?
Yes.
Do you know, have you got an idea of the number? Is that something you could get to me?
Yes, absolutely.
Yeah.
I think is it on the dashboard?
Yeah, it probably is. I'm also wondering what the current cost is as well.
Certainly, the number is currently available and publicly available on the dashboard. In terms of cost, we could get something.
Thank you.
An estimate to you on that.
Thank you. How many of the newly recruited family time workers and caseworkers since September 2024 are Aboriginal and or Torres Strait Islander? Is that something that you...
In terms of the family time workers, I'm not sure.
We're still wrapping up the recruitment. We're not finished yet.
Right, so it's not
Okay.
finished?
Yeah.
Okay. And is it looking like there are...
There's a mix of people. Yeah.
Okay, thank you.
But there is good news in terms of the family group conferencing. Is that?
Aboriginal facilitators?
Yes.
Yes.
Yep.
Yes, I don't have the numbers, but yes, there has been.
Yeah, there's. As I last saw, I think the people on the panel, I think 46% are Aboriginal.
Yeah, we can check that.
But we can confirm that a bit later.
Okay.
I think that's what we saw, but it was certainly a high proportion of those workers are Aboriginal and able to support important conversations with Aboriginal families.
Thank you. The recommendation from the system review to consider a sector-wide strategy to attract, recruit, retain and recognise the value of DCJ workers, and I know you're really passionate about this, at a time when DCJ is considering its statutory footprint and the role of ACCOs in working with families. Why at this point is there a drive to increase the DCJ workforce? What do you see in terms of that focus?
Well, it's to ensure that we are ensuring that we can provide the support and services that families need at the right time, in the right place. So we are absolutely recruiting and trying to do as much as we can to ensure that we have the people on the ground that can keep children safe across the state. What we're finding is that within the department, across the state, and the conversations I'm having, and I've met with more than 1,000 caseworkers across the state since I became minister, is that there is a sense of change, that they are feeling the change. Even the work that we've done with removing ACAs from the system that will be effective as of the end of this month, the workers on the ground are feeling that there is reform on way. They've known that they've needed it for a very long time. And so there is a sense of momentum. I do always meet with them and ask them to hang in there, because I know how difficult and complex and challenging their work is, and at times it can be heartbreaking. But the people that are in the system now, I know that they are so dedicated in their roles, and we want to ensure that they feel valued and that they have all the supports that they need in place to keep in the job and doing the important work they do.
Thank you. Just in terms of the legal assistance for families partnership agreement, I'm just so it's the partnership between DCJ Legal Aid and the ALS, and it's intended to see the early referral by DCJ of families for legal advice. And this was a recommendation of the FIC review report, and it was also referred to last year at budget estimates as a positive step to improving outcomes for Aboriginal and Torres Strait Islander families in contact with DCJ. Do you know, and perhaps it's something for later, but I'm just curious, how many referrals has DCJ recorded that have been made?
Certainly, the acronym is LAFPA. It's not the best acronym, but it is proving to be a great success.
Right.
And there have been an extraordinary number of referrals made.
I've only got the July to September 24 numbers in front of me, but I can give you...
let's, perhaps even if we can talk about it some more in detail after the break when we've got a little bit more time. But Minister, in terms of your oversight and you're saying that that's something that you're you're looking at as a good outcome at the moment?
Oh, indeed, because what I'm hearing from the people that are delivering the service is that they are getting in at the right time to give information to empower people who find themselves in some of the most stressful situations they might have in their lifetime. So empowering people and families at a time when with legal information and advice is proving to be a real game changer.
And do you think that, would you be willing to say, just from the lens you have, do you think that it is possibly preventing children from being taken from families and so on? Do you think it's having that level of impact?
I truly, as you can imagine, I truly hope so.
Yeah.
It's yet to be evaluated, and the only data I've seen so far has been the referrals, and I've asked exactly the question that you're asking. What is that translating to in terms of decisions and placements? And I await that advice eagerly.
We all will. Thank you. I just know it was one of the recommendations from early on, and it seems to be finally getting that traction now in terms of its implementation. Do you, in terms of the active efforts, what do you see? Do you see that do you see that the changes are making a genuine impact and the reform, or do we have to go further? Where do you see in terms of, and I'm kind of going back to that initial first, Megan Davies, her recommendations of what had to change, and we made partial changes. What is your tracking and view on where we're up to?
Because we proclaimed the active efforts, they became effective late last year.
November 23.
2023.
Apologies.
Yeah, it was 2023.
I've missed a year.
Yeah.
Which is not surprising given the amount that we've got going on. Yes, so we are tracking active efforts closely to understand the impact it's having in the system and the decisions that are being made. I can speak to some of the conversations I've had anecdotally with caseworkers who've had some of the beautiful outcomes where they have tracked, found family and managed to engage family, and children have not come into the system as a result. Young Aboriginal people, that was a conversation I think I had in Tamworth. And caseworkers genuinely saying that they were enjoying the work that they were doing because they were seeing better outcomes applying active efforts.
So do you think they've got a good do you think that understanding of active efforts and what is required, because it's a big deal, I mean it's asking a lot in terms of actually making it work, but we always knew that if it was well understood and implemented. So do you think that it is looking good in that sense?
I think we've always got more work to do. We want to ensure that what's happening across the state is consistent and that there is good practice coming from every district in terms of ensuring that active efforts are being undertaken. Of course, we've got a lot of work to do in terms of making sure that caseworkers have the time to be able to do the work that needs to be done as well, and that goes to our the focus that we've got on carer. Caseworker recruitment and retention. So there's always many moving parts to this, but I would say combined with the proclamation of active efforts, we've also changed part of practice amongst our caseworkers around the risk assessment and the replacement of the risk assessment tool that had the actuarial element to it that stakeholders did not want to see any longer. That's been removed, and we've now got an interim risk assessment in place, and the longer term risk assessment approach is going to be co-designed with ABSEC and ALS.
Can I just, am I still going?
Yeah, you go in there.
Yeah. Can I just ask you, did you want to add to that based on what I know? I did see Ms. Jarrett pass something, and I'm just thinking.
Yeah, Ms. Jarrett has just reminded me that we've got our first annual report on active efforts due in December this year.
Great.
So that will be tabled.
In December,
Yeah.
but I can talk to you more about that
let's
in the
talk
afternoon.
about it
Is that
some
fair?
more. I'd love to know some more about
Sure.
what you're seeing in that sense. And in terms of the tool and the interim tool and the tools that are being developed, what are we, are there any dangers at the moment in the transition or the change of the tools that are now no longer being used, which was a good thing, obviously everyone welcomed that, but the period we're in now while we're developing new tools?
We are watching it so closely to ensure that we keep heading in the right direction when it comes to the reduction of the number of children coming into out-of-home care. And there has been a reduction in the number of Aboriginal children coming into out-of-home care. There's been an overall reduction of children, of Aboriginal and non-Aboriginal children coming into out-of-home care, but similarly there has been that reduction. And so we want to ensure that all of these changes are being tracked and measured as best we can, but obviously they are all intersecting and having decisions being made on the ground. We'll have all of these changes will be in play. I might just also go back for a moment on the LAFPA referrals.
Yes.
There's more. I knew that I'd been to function to discuss progress, and I couldn't remember what the number was, but there's been more than 2,000 referrals to LAFPA since November 2023.
Can I just ask, thank you for that, can I just ask, in terms of the use of emergency powers, I know that we spoke about this briefly in the last estimates, but one of the 9 priorities identified after the August 2023 Reform Forum was the review of those emergency powers. Have there been children removed by warrant that you're aware of?
This is an element that, as I said, I report to the MAP group at every meeting. In terms of the latest on that, I might ask Mr. O'Reilly to...
or we've only got a few minutes and over to the other side, but perhaps we could talk about the use of the emergency powers after the lunch break.
We certainly prepare that data
thank you.
regularly.
Thank you.
We provide it to you.
Thank you very much. I just want to touch on the working from home policies, in particular in light of the media around a district director that's working interstate. How many other senior staff are working interstate or not in the area where they're based to work?
Well, if I can go to that to the question directly, the Premier was clear in his response to this issue, and I've got to say he's absolutely correct, and that's an unreasonable situation for taxpayers. But in terms of the particular individual that was highlighted in the recent media reports, I've got to say it was also an entirely unreasonable situation for him as well. And that, and I really do want to put it on the record, that Mr. Garahy is an exceptional public servant, and we are truly lucky to have him. And I know that he has been deeply uncomfortable with the length of time of his acting arrangement. So he and his family, I understand, have been willing to make the move in the event that his position became permanent. So in this particular instance, I've got to say, myself as Minister and the department, we've got to take it on the chin and not Mr. Garahy. And we will obviously be looking at what other arrangements there are, but in terms of employment arrangements, obviously that is a matter for the Secretary.
Can I ask if all officials here today are located in the area where they are employed?
Well, can I just say to that before officials answer, I would say that their responsibilities cover the state. And when we've answered questions before about who does what, where, and about the working from home initiative, 75% of our workforce is in the field, and it's similar for our directors, our across the board, that there is a lot of movement across the state constantly to cover positions, to be in other places. So I would just say that more broadly.
That's why I'm asking the question, Minister, to find out if there are more senior staff that are based outside of the district that they're responsible for, or that the department is paying for their travel costs.
Can I, at the head of that question, just on the interstate question, note that the circular that issued from the Premier's Department, Circular 3 of 2024, introduced a requirement that the Secretary has to approve where an employer resides outside of New South Wales and is not principally attending a DCJ workplace, just to deal with that issue. That is so new obligations arose as a result of that. That speaks to the matter that's been highlighted in the media. I'm, as a matter of urgency, conducting an audit of all those arrangements in terms of all other staff staff here today. They are working within totally within the guidelines.
Thank you.
All right, we'll go to government questions.
No questions.
No questions. We had one before.
I know, but we're very satisfied.
We're
with
banking,
the fulsome
we're
results.
banking our questions till later.
It's Mr.
You've got
Donnelly.
quite a large
He's
bank.
the banker.
I've been called other words like that before, but not
If I might,
I won't
Chair,
argue with that, yeah.
If I might, Chair,
Minister,
I might
please.
just take a leaf out of the Attorney General's book, and I know that this committee will always be respectful to all of the people giving evidence today, and particularly our public servants. But in this afternoon, again, just want to urge that they are treated with the respect and dignity that they deserve, because these are some of the most hardworking, dedicated professionals that I have ever worked with, and I know that the committee will continue to.
As we always have.
Continue to treat them with the respect and dignity that they deserve, particularly given that a lot of our workers are currently in evacuation centres. And so if there's any opportunity for the team here to depart early, that would also be most welcome. Not that anyone's trying to hide anything at all. They've just got important work to do, and I know that they're getting messages at the moment about evacuation centres. And so that's work that is underway whilst they're here as well.
Minister, we actually had a conversation about that during the break, so it will be something we'll update at the
I appreciate
at the next
it.
session.
Yep. Thank you very much.
All right, thank you, Minister.
Thank you.
This committee is
Thank you.
generally quite well behaved. Not always.
Under your leadership, Chair.
Thank you very much.
Thank you.
Thank you.
Turn at 2 o'clock.
Thanks, Minister.
Right, thank you all and welcome back, and we'll move over to the opposition. Thank you.
Thank you very much, and thank you again. As indicated before, I'm going to actually work to put a number of my questions on notice so that everyone can go by afternoon tea. I do want to say thank you very much to everyone, and Mr. Bill, please, if you can relay, particularly from the opposition, our appreciation to everyone from your department, but also to the voluntary organisations that are all working tirelessly on the ground. All your efforts are greatly appreciated. In line with that, I'm interested just to ask about, has any discussions occurred around supports that may be made available to NGOs on the ground? I know in the last previous floods, there were some emergency packages. Has any of those discussions been had at this stage, or do you think or anticipate there might be a need?
So, since Thursday, am I on? Yes, I'll assume I am. Since Thursday, the focus has been on evacuation. It now sort of pivots to recovery. This has all happened very quickly. I'm at this juncture just simply, it's not that I just don't quite know specifically what I can add at this point. Clearly, it's a very tightly and well coordinated response. DCJ has a role to play, a remit, which is part of a broader ecosystem. Beyond that, I really can't.
Yep. No,
I don't have knowledge of anything else at this stage, but that doesn't mean that there won't be things happening in coming days.
Yes, no, that's fine.
Ms McLaren-Jones, we're just going to pause the clock for one moment. My omission at the beginning of our session, I note that we just need to swear Ms Ward in because you have not yet been sworn in. So if you wouldn't mind, please stating your name, position, title and swearing either the oath or the affirmation.
Of course. My name's Rachel Ward. I am the Acting Children's Guardian from the Office of the Children's Guardian, and I will take the oath. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you very much. Right, we'll continue. Sorry about that.
No, that's fine. Thank you very much. Just following on from this morning, in relation to the 7.1 million for the task force, the disability task force, the Minister indicated, so there's 19 full-time staff. That would work out to be around 370,000 per person. So I'm assuming that there is an underspend.
Over 2 years.
Over 2 years. Okay. Has there been an underspend in that 7.1?
No, because it includes, as I said earlier today, 19 FTE across TCO and DCJ. But we also organised consultations. There are OPEX costs, we call in government language, which is the on-cost. So I think, happy to provide on notice the average across that, but I think it's much less than what you've just said.
Okay, great. Thank you very much. Now, moving to residential care. The average placement costs have previously been provided by DCJ for the high-cost emergency accommodation across the residential care categories, but it only included ACA, the individual placement arrangements, the special out-of-home care, and then the short-term emergency placement, but not the interim care model. Was there a reason for that?
I don't know if there was a reason for that omission or not, but we can find out for you.
Yep. And could you then provide the last 12 months, similar to the last question that was taken on notice, and I think it's page 35, where the breakdown was provided across the quarterly average. If you could then include the ICM data, that'd be great. In relation to intensive therapeutic care homes. Now, you indicated this morning they're extending. Is that correct?
You're talking about the increase to 900, the increase in numbers? Is that what you're talking about?
I think you indicated there's an increase, expansion of the program. Is that right?
Well, there has been, yeah. Yep. We're still finishing the rollout of the expansion, but the increase that we discussed this morning from dashboard to 900, I should add, the counting rules for that include other residential care categories, not just ITC. So they include some of the high cost arrangements, not all of them, but some. So they include IPAs, ICMs. They also include STEP and special care as well. That's why, the other reason why the number is much higher.
Yep. And just on that, so there's, of the residential care subcategories, in one of the answers, answer 1846, at the bottom it indicated that there are lots of different types of residential placement: disability group home, disability residential, family group home, individual placement arrangements, intensive therapeutic care, interim care model, I think, the legacy pre-existing PSP, and then short-term emergency. Could you outline what goes into the HCEA and what is purely the subcategories of residential?
Yes, I certainly can. So HCEA includes some specific categories. So alternative care arrangements, which is the one that we're about to close down later this month. It includes the STEP, the short-term emergency placement, which is a 1-to-1 or a 2-to-1 placement for high needs children. It's accredited, of course, with ResiCare staff from those providers, and it's up to 12 weeks.
Yep.
We can give you more details, but I'll go through the list. ICM, which you mentioned earlier, which is interim care, and this is for placement breakdown in ResiCare or new entries who are waiting for a spot in ResiCare, in ITC. And then there's special care for children with disability support needs, and this is quite a specific category, low numbers, and some of the oversight and monitoring is the children's guardian, and the providers need to be accredited disability providers.
And Waratah cottages will not fall under HCEA?
No.
They'll go under residential care?
Yes, a different kind of residential care. It's run by DCJ. It has a facility for younger children, and because we are targeting sibling groups.
And what's the age group for that type of residential care?
For the DCJ
DCJ ones, yeah.
Well, it's sibling groups who need to be housed together. So, as you know, for ITC, the age group is 12 and up.
Yep.
We are much more flexible with DC ResiCare because it means we can get sibling groups together. So the children could be younger than 12.
So they could be newborn?
Unlikely that newborn would be in ResiCare, but very, very unlikely. But they could be younger than 12. They are younger than 12.
So what's the youngest you would take?
I'm not sure what the policy is off the top of my head, the youngest we would take. But again, these are kind of judgment-based decisions about trying to keep kids together wherever we can. But for newborns, we would normally go for emergency foster care instead. And then there's a consideration about the importance of that compared with the importance of keeping siblings together, balancing all of that.
If you could take on notice what the policy is about the youngest age, because I'm obviously interested if you've got 3-year-olds, 8-year-olds, 10-year-olds with 15, 16-year-olds that are from different families.
Yeah, and
how
you might recall earlier today I was talking about the matching process. So that's really important, which is why we sometimes carry vacancies in ITC and most likely will in DCJ ResiCare as well. Small amount of vacancies because we won't be matching children where there's not an appropriate match, and an extreme age difference when the kids are not related would be inappropriate. So there's safeguards in the decision making to make sure that we don't put kids at risk.
Okay. And so with the ITC, the average stay you said is 13 weeks, is that correct?
ICM.
ITC.
Yeah, I don't think I talked about an average stay for
Is
ITC.
there an average stay?
ITC can be longer than that.
Okay.
Yeah.
And what's the longest amount of time that a young person's stayed in an ITC placement?
Well, ITC can be very long, like until 18.
Okay.
Potentially, yeah.
And do you have an average age or the youngest age of a young person currently in?
Well, ITC is for 12 and up.
It is. So there isn't anyone under 12?
There could be some under 12. Sometimes they are approved by exception, particularly if they are in a small house with only siblings. Their siblings, they could be approved with different approval mechanisms. That's possible, but the policy position generally is 12.
Can you just take on notice if there is?
I will.
And how many might be under?
Yeah.
Or how many are under 12?
Yeah, absolutely. And just again, that they are individual decisions based on family connection,
Yep.
if they are approved, yeah.
Just in relation to ICT, I came across on the website 4 different types. ITC, significant disability therapeutic care, the supported independent living, the therapeutic sibling option placement, and then the therapeutic home-based care. Could you explain the difference between the four?
I can try, certainly, but some of this I might need to take on notice.
Yeah, no, that's fine.
So ITTC, that's a transitional care model for children who need a particularly intensive kind of therapeutic service before they return to an ITC or somewhere else. But that is a very small program. There's less than 30 places across the state. It's very small, and they're distributed in different locations.
Yep.
4-bedroom houses. The other ITC, there's disability ITC, which I mentioned earlier, and therapeutic home-based care, where we are providing services in the home with children and carers.
Now, with that one, is that in the home? Do they have rostered staff?
I might come back to you just for completeness about the range of scenarios where the therapeutic home-based care is provided, because there would be a range.
Okay.
So we'll take that on notice.
That's fine. I might move on to Roche reports. Looking at the dashboard data, which I know it comes up to, I think, September last year, it says that during that quarter, 9,639 children needed a response within 24 hours. I'm interested to know how many received a response within 24 hours.
Do you know the answer?
No, I have to take that.
Yeah, we will need to take that on notice.
That's fine. I assume you'll need to do the same for the 29,544 children that required a response within 72 hours.
Yes, happy to take that on notice.
Just checking from... Might move on to care plans. How many Aboriginal care plans or cultural care plans are in place at the moment?
Yeah, I think we have that.
Yeah,
I think we do.
We do have that.
We do have that. I can 81% of kids under DCJ out-of-home care have cultural care plans, and 74% of children under NGO out-of-home care have cultural care plans.
And how does that compare to last year?
I don't have last year's figures right here, but if you're willing to live with some paper shuffling, I'll see if I can find it.
Yep. While you're doing that, I might have a question from Ms Campbell in relation to the Aboriginal Child Family Centres. A question from last year indicated that contracts were being finalised last December, and there's a second round early this year. I just wanted to get an update in relation. That's the additional one, so I think it was 6.
Yeah, I'll hand over to Ms Jarrett.
Oh, you have to on that. Yeah. So we've committed to do 2 rounds of a request for process, so 2 tenders. The first stage is just about to be finalised, so it's still open. And that was targeting 3 priority locations that PricewaterhouseCoopers had identified in the report that they developed for the department. And we have committed that the 6 new centres will be built by December 2026. And the enhancement funding, which is attached to that program, will also be completed by December 26 as well.
Okay, and so all up and running by the end of next year?
In terms of handing keys over to new dwellings, new buildings, but actually operational, some of those centres might not be operational until June 27.
Okay, all right.
Yeah.
I have that response if you like.
Thank you.
Cultural care plans. So at the end of June 2021, 60.3% of Aboriginal children in care had a cultural care plan. At the end of June 2022, 75.5%. At the end of June 2023, 79.7%. And at the end of June last year, 77.5% of Aboriginal kids had cultural care plans.
Good, thank you very much. Just back to Roche reports and closing because of competing priorities. I previously asked a question, I got it, I think it came through as a supplementary in relation to the breakdown by district. And it was over the 2023-24 period. I just wanted to get a better understanding across the Central Coast Hunter. It said, and by putting the two figures together, it's over or close to 26,500 reports were closed due to completing priorities, which is significantly higher than any other district. This is Roche reports closed due to competing priorities by district 2022-23. That's okay.
Sorry, can you? Can you just repeat it?
Yeah. So. Supplementary question that was put in last year, in regards to number of reports that were closed competing.
Yep.
The Central Coast / Hunter District had, combining the two figures, came to 26,466 reports were closed due to competing priorities, which is quite hard. It's quite high. If you in this dashboard, it actually has it broken down. Central Coast, I think 7,500, and the Hunter was, I think it's 18,000. But it is quite high, so I'm just interested to know.
I understand the question. I think we would like to give it a considered response if we may.
Yep.
If I can take that on notice.
That'd be good. The other one is in relation to the Southwest. They had 14,000. And the reason I'm asking is that if you look at the staff vacancy rates, in some of these areas, it's not, like particularly for the Hunter, they weren't that high, and yet they're still not able to get to the Roche reports. So is it about staffing allocation? Is there something more that's happening?
Yes, if I could attempt to answer. Thank you for that question. So there's a few things that happen. Largely we sit in a space where we do not, where essentially we have a supply and demand issue. So we shouldn't work on the basis that we take all of the Roche reports coming in with the allocation or available caseworkers that we have and work in a premise where we would be able to see everybody. We know that we sit in a space where the child protection system does have a supply and demand issue, where we see a year-on-year increase of Roche reports, and that really then sits in the space around what does the department do in regards to delivering our best child protection service, but also from a broader reform agenda. We need to determine, for instance, early intervention, family preservation, and a range of other things that need to be available to us to be able to see as many children and young people reported at Roche.
Can I get the update for the last year, the 23-24 figures, based on that same breakdown by district?
Yes, of course. We can supply that.
Just interested in contract variations, and this relates to PSPs. Has there been, or how many contracts have been varied in the last 12 months with NGOs?
Yes, I got on notice.
I think we take that on notice.
Yep. Just in relation to the portable long service leave, you'd be aware that number of organisations or the NGOs have raised concerns in relation to the implementation of this and the cost it's going to have on staff. What discussions have been had in relation to providing assistance and support to these organisations?
I think this came up at an earlier hearing, and as you know, most other states and territories who have this provision haven't provided additional funding. We're obviously developing the election commitment about funding certainty and secure jobs, so we'll be looking at all those impacts on NGOs and on staff, but I think our calculations were about 0.7% increase, and that NGOs should be factoring that into their existing funding envelopes.
Okay. I'm going to hand over. I've only got a minute.
Okay. Okay, well, I'm now handing over to Ms. Abigail Boyd.
Thank you very much, Deputy Chair.
This is your line.
Can I ask, I just want to come back to some questions around specialist disability accommodation. There's been some reports that the New South Wales Government is preparing to tender for the sale of its legacy stock of SDA. Can you confirm whether that's the case?
No.
It's not?
No.
Oh, that makes it
At
easy.
the moment, we're consulting with STA providers in New South Wales around currently leased properties to look at. I think going to your question this morning about are there other ways in which we could have more contemporary housing options for people with disability currently in DCJ owned properties.
Okay, that's good. Right, because a lot of that legacy stock is group homes. Understand they're sort of not accessible and don't really meet a lot of the standards.
They're pretty old, some of the properties. I think the average age is about 27 years. And we know that there are a number of vacancies cropping up as people move into other options. So I wouldn't say that they don't meet standards, but they wouldn't be what we would consider contemporary and fit for purpose for people with disability.
So is the plan to sell them?
Not at this stage.
Okay. Are you able to tell me, maybe on notice, how many SDA participants currently reside in the New South Wales Legacy SDA stock?
I do have that in my folder, so I can come back to you.
Yep. Yes. Also the estimated value of that stock. That's possible. That would be great. Okay, I'm just checking the rest of this was around a tender process, which apparently doesn't exist, so I don't need to ask you that.
I can actually answer one of your questions.
Thank you.
The number of SDA participants or NDIS participants is 2,587 currently residing in SDA properties, and 686 of the DCJ owned properties are enrolled with the NDIS Commission for use by the SDA through registered providers, and so they're occupied for SDA use.
Okay, great. I think that actually has removed most of my questions. I might just ask one. There you are, Ms. Mackenzie. Sorry, I was looking around for you. Where's she gone? I noticed in the, I'm sure you've seen the restrictive practices consultation paper that came out. And I understand the current proposal is to establish the role of a senior practitioner. I guess, have you had any involvement in the development of that consultation paper?
So the ADC provided some input or feedback on a couple of drafts of the consultation paper.
Okay. Do you have any understanding as to whether that senior practitioner will be established under DCJ or as an independent statutory authority?
I don't. There haven't been any recent conversations with the ADC about it sitting with us, and I don't have any information about where it would likely to be sitting.
Okay. You won't be able to answer that question I was about to ask you. I think that's all I have, actually.
Okay.
Thank you.
Thank you. I just wanted to, if it's okay, and I think I might be heading your way, Ms. Jarrett.
Yeah.
I'd just like to know a little bit about the. I think in the last budget estimates, Mr. Tibble said about transforming Aboriginal outcomes being evaluated. There was an evaluation at the time of 4 September 2024 budget estimates hearing stating, I'm not verbling you, I'm just the words Mr. Tibble was speaking was, right. We're really interested to see how transforming Aboriginal outcomes is configured to sharply respond to the Closing the Gap agreement. I'm just curious if the committee could understand, have changes been made to the Transforming Aboriginal Outcomes structure as a result of the evaluation? Where's that work up to? It may be you, Mr. Tibble, that's best to answer it first, or Ms. Jarrett.
I think we can jointly have a crack at it.
Yeah.
We are, as indicated at those estimates, working through a process, and quite rightly, Teo has had a high degree of ownership of that work. There's been only one tweak to the structure of Teo, which is the anti-racism unit, for reasons that we talked about and agreed, and it needing to be clearly a DCJ-wide unit that that has moved out of TAYA, but structurally everything else is the same. Natalie Walker, who is highly regarded, is undertaking that review. She's progressing that review. I think Ms Jarrett can probably more precisely advise the committee on exactly where it's at.
Yeah. So the Secretary is right. The anti-racism unit has recently transferred over to Mr O'Reilly's division, system reform. And inside policy, we're engaged to conduct an independent review. That review has been completed. We're just waiting on the final report to come back. And then we will look at what that proposes, that review. We do know that we've got a number of temporary roles in the division that were added to help stand up the more robust coordination of closing the gap across the department. So the review will certainly look at how we can build in those really critical roles into our budgeted structure. So that's the work that will be happening over the next few weeks.
Great. So is there, when you say the next few weeks, you think that, do you think we'll get to a point where, we're looking at the structure and system going, hey, this is the very best we can do, or that we believe is the best right now? And then is there a system of continuous improvement, or what does that...
I think it's kind of multifaceted. We need to think about where can we have the greatest impact, where can we ensure we're doing the work that is not duplicating work that's happening across other divisions. You might have noticed Minister Washington was directing a lot of Aboriginal focused questions to me, but we are the smallest divisions in the department, so we can't possibly be across everything Aboriginal, because there's Aboriginal impacts in everything that we do. In the department. So I think it's really thinking about where can we have the most impact, and really drawing a line in the sand and saying, here are the things that we won't do, but here are the things that we will do, because we believe that it's going to create the best outcomes for Aboriginal children and families.
And do you have, with your oversight of things at the moment, do you have a high degree or a medium degree of confidence that we will actually transform outcomes?
Look, I do. I'm cautiously optimistic. I think there's some really great work happening in the child protection out of home care system reform. I think the Minister's been very upfront that, the system needs to change, but it's going to take a long time. But we're starting to see a lot of those changes starting to happen. And, I think it's working towards a bigger picture. I do have a level of confidence that we are heading in the right direction.
Thank you. Of the children that I think the 8 children that are still in the alternative care, what was were any of those children Aboriginal
3
children?
of them Aboriginal.
Sorry?
3.
3. Okay. And what are the ages of the 8 children? Is that
the youngest is 6.
Right.
I don't have the detail of the others, but the
What's
youngest was the number I was most focused on.
Okay, yeah. And what about the oldest? Did you have that figure? No, the youngest, I agree, is the one to be looking at. Thank you. The recommendation that the New South Wales government and DCJ should create effective models of care within the out-of-home care system to cater for all children and young people across the continuum of care. This is probably for you, Mr O'Reilly, possibly you, the Secretary. So in relation to this, will you or are you partnering with Aboriginal peaks, Aboriginal community-controlled mechanisms formerly under the Aboriginal Case Management Policy, ACOs and community in relation to what is a large program of work?
You're referring to recommendation 7 from the system review?
Yeah.
Yeah. We absolutely are. And it's a good point that the review has found in terms of there needing to be more clarity and direction in terms of acceptable service models. I think that's a really good point, because one of the impacts of particularly the funded services model is that it is very broad and diverse with all sorts of practice approaches. And so it is important to use this opportunity of big reform to make decisions about what is the standard of practice that we're willing to accept in this work. particularly when we look at the findings in the review and in a lot of the public discussion about some of the conditions that carers report and children in care report, and some of the slow progress in terms of restoration, which arises sometimes from slow progress in building family connections while kids are in care. So I think all of those factors mean we absolutely must have more direction around the service models. So we work closely with ABSEC and Aboriginal Legal Service and other Aboriginal stakeholders. So I want to be really clear.
Yep.
We partner with CAPO on all of this closing the gap work, but any Aboriginal group or stakeholder in New South Wales has a seat at the table with reform. They're very welcome, and we are getting great input from lots of people. So there are a number of key policy areas where we are looking to partner now on developing the model of working, not only in the child protection area, in those key areas around prenatal policy, risk assessment, triage of risk reports, review and revision around the use of emergency removal powers. Those matters are really important to Aboriginal stakeholders, and all of that work will be co-designed with those stakeholders. In the out-of-home care area, it is similar. So we work closely with ABSEC again, we work with ACOs, we work incredibly closely with the Teo team, Bianca's area, and we report to the MAP group regularly on progress on that work. We will be supporting the Minister to return to Cabinet later this year with a more detailed out-of-home care strategy for the future for consideration of Cabinet, and that is a critical milestone because the current contracts expire June 2027. Yeah. We need to do some program redesign and recommissioning ahead of that milestone. So the reform plan, which was launched a couple of weeks ago, makes some pretty clear statements about the way that we need to work differently in out-of-home care, particularly giving children a voice, particularly working on models of relational care, which is a central part of our new way of working. Those key design elements, if you like, they need to be consistent in our reform work and our reform narrative, the way we work with those partners between now, getting an out-of-home care strategy approved through the Cabinet process, redesigning the program, redesigning the contracts, and then going back out for a recommissioning in a couple of years. So it is a very, I guess, linear process in one sense with those clear milestones, but it needs to involve lots of consultation if we're to deliver on those design elements in the reform plan.
And so with that, how many Aboriginal community control mechanisms have been set up as part of the case management policy?
So ABSEC have been funded under Safe Families Our Way to establish 15 Aboriginal community control mechanisms.
Right.
I believe 3 are currently operational, but there are another several that are will be operational imminently. But I can provide you some more specific information on notice.
Thank you. And what about, so is there sustained at the moment, is there a view that there will be sustained funding for the mechanisms, the Aboriginal control mechanisms?
Nothing has been committed at this
stage. That's a decision for the government down the track.
Yeah.
Okay. And so is there, I suppose then, gosh, I always get in trouble here with the asking and digging. I wish we could all just ask all the things. So without, please only answer what you think you can, but at this point of time, do you anticipate that there might be some benefit in or advice forming around the future sustained funding for the Aboriginal community control mechanisms?
We can't comment on future funding, we just can't. But we absolutely...
Is the analysis, perhaps what I'm asking then, is there an analysis that that this is good bang for buck?
Yes. So as Ms. Jarrett said, we're early days with Yakams, but we're really excited about that work. We work closely with ABSEC, who's implementing it, and we are watching closely alongside them. And any analysis of their impact, their effectiveness, that analysis will be done with ABSEC.
Thank you.
Yeah, but we can't comment on future funding, obviously.
No, I appreciate that, and I'm sorry for asking. It's the unsophisticated nature of trying to get some information that is not the thing I'm actually asking for. Thank you. Has there been consideration about the recommendations of the ACWA in their September 2024 paper, The Future of Foster Care in New South Wales. Have you looked at that?
Yes,
Yeah?
we have, and I won't be able to comment in detail on them because, as you might appreciate, we are responding to some recommendations from the Audit Office and the Ombudsman right now. We have some reporting deadlines looming.
Yeah.
And so there are about 250, 260 recommendations from various regulators and others that we are responding to, trying to synthesise our response to those because there is so much overlap. And obviously input from other sources like the AQUA paper, coronial findings, serious case review findings, all those inputs are valuable as well as we respond to all of that.
Okay, can I ask then, what is your, given, I know you're very busily trying to respond to all of these very important recommendations, do you have a time in your mind's eye as to when all the responses to the current systems reviews and recommendations, so that we can literally be at a point where we're not looking back as much as we have had to and we're looking forward? Is that a place you've got a line drawn for yours?
Oh, it's crystal clear on our horizon, in one sense, because all of these reports have public reporting deadlines.
Yeah.
So we're reporting in May on the Ombudsman's review into complaint handling in child protection.
Yep.
We're reporting in June on the Audit Office report into oversight of child protection.
Yep.
Reporting in June on the Audit Office report into safeguarding Aboriginal children.
Yep.
We'll be presenting to a Committee of Parliament in August on those two Audit Office reports as well. In December, we're reporting on the Ombudsman's report into protecting children at risk. That's in December. The Ombudsman's working on other reports as well. They're currently working on responses to Roche. They're currently working on a review on ITC. And they're working on a review on children absent from placements. So those reports will land in about 9 months from now, we think, roughly. And then there will be a fresh set of recommendations from those reports that we will need to work on. But we don't wait for those. We must have responses to those statutory reports May, June, August, December this year.
Thank you. Just in relation to, and I think Ms. McLaren-Jones touched on it earlier, just in relation to education outcomes for children in out-of-home care. Has the work commenced on reviewing the model? I think there was some touching on it earlier, but it was proposed in the systems review. Yeah,
it was recommendation 11 in the systems review. Sorry, recommendation 12, I think, in the systems review. And recommendation 1 also talked about a different government approach for out-of-home care, where government agencies work together to oversee the out-of-home care system. So those two recommendations work together. Yes, we have started talking to education and also health about the health pathways work. And in the next few weeks, we will have to firm up a stronger position on that. The complexity there, of course, is that we have to optimise and improve the work that's underway so that we don't lose momentum, but we also have to respond to the systems review report, which asks for a new and better way of supporting kids in out-of-home care and their education. Have the children and young people in out-of-home care been involved are they inbuilt into this work in terms of the review? There certainly will be consultation with children. We're not at that point yet, but yeah, we're very interested in consultation with children.
Thank you. And would there,
and carers and parents.
And excuse I'm not being cynical, but in terms of that, whenever I hear the word consultation, I know all of us just go, oh gosh, is that later? Is that so far down the track that, would that input of, I think there's a particular case for the lived experience of young people in the system being before we've even thought about what it is we're designing in terms of review. Is that something that everyone is committed to in terms of very early engagement? Yes, but I should add, and the third element in the out-of-home care reform plan, which was published a couple of weeks ago, talks about creating mechanisms to give children a voice in this work. That's about ongoing mechanisms as well as in this design phase. So we absolutely do want to do that early, but I also need to highlight the complexity of this. This is about changing the way that DCJ delivers services, education delivers services, health delivers services, and is subject to decisions of ministers and cabinet and government. So there is a balance to be achieved in terms of consultation and providing options to the decision makers. So we are careful not to
not to make commitments around co-design which are not real co-design. We are working hard to make sure the voices of young people and children are included in this work, but we will need to come up with a model that responds to the findings in the report in a substantive way, quickly. That's the challenge here. So it'll be consultation with some transparent limitations, I think.
And there will be a specific channel avenue for the experiences of Aboriginal and Torres Strait Islander children,
Yes.
given the... Thank you.
Yes.
I'm just curious, in my last 40 seconds in this round, in relation to the recommendations of the Office of the Children's Guardian, given the systems review has recommended a review of some of the Office of Children's Guardians functions and a collaboration with DCJ to clarify those roles and responsibilities, do you consider that, has there been any further consideration about... I did touch on this with the Minister and she was quite specific, but I'm just curious, has there been any fleshing out about this as an opportunity for broader review in relation to I suppose, a broader function for the
I think
child protection system?
The straight answer to that question is just that I refer you to the Minister's answer this morning.
Fair enough. Thank you. Slap me down. Over to you.
Thank you. I might just follow on from the plan that's come out, just in relation to the, I suppose, column 8, delivering value for money, and a time frame around the out-of-home care program design and recommissioning. More broadly, did you say that's going to start next year, or...?
I can talk about the timeline. So the first sort of dot point in that column around delivering value for money is really about pricing. And this program has been referred to the Independent Pricing Regulation Tribunal, which is currently working through all of the pricing issues in relation to care pricing and carer pricing, I guess, or the cost of caring. There was an interim report delivered in September. We anticipate a more wholesome or a more fulsome draft report in the next few weeks. And then I believe the final report is due in May. And with any IPART report, government then needs to consider its response to that. And then there may be a process of, factoring that into the ongoing setting of the budget for the program. So those pricing inputs are really important before we make decisions or make recommendations to the Minister and the government about what the future design is going to be. That's, the importance of the IPART work happening now. Options to government at the end of the year, and then redesign following that ahead of a recommissioning process 26-27.
Okay. And then in relation to any changes in modelling that may occur, have you done any work around potential NGOs that would leave the sector? And what impact that could have, and what additional resourcing the department would need?
Well, government hasn't made any decisions or announcements about the market mix, if you like, about if or the extent to which NGOs may leave the market or the government may take on more market. Those decisions are not yet made. But typically, when such decisions are made in a market model, the impact has to be modelled, but that hasn't happened because the decisions have not been considered yet.
Okay. But then when it says the establishing of new fit-for-purpose residential housing assets, I assume that's the Waratah Cottage. Is it any other?
It also relates to ITC, Intensive Therapeutic Care. It's a large program, and we talked about it a lot today, but it is on a similar recommissioning cycle, and it is ready for evaluation and also review and design work as well. So I mentioned recently the Ombudsman's review into ITC is happening. DCJ is also committed to a program evaluation next year, and it makes sense to hold that until the Ombudsman's delivered their findings, of course. But that evaluation of ITC, the work we've done to eliminate ACAs and refine temporary placements, we're currently doing some work to develop some far more appropriate accredited interim care models for when placements break down. So those sort of changes are happening now, and they will form a future diverse residential care system alongside the review of ITC, and they need to be fit for purpose, contemporary, safe, addressing all of the issues in ITC that people talk about now and that the Ombudsman's report might reveal and that our evaluation will reveal. So it's recognising that residential housing and care is a critical part of the system, and while we're doing a broad system reform, we have to include that as well.
And so is the aim that the department would then bring residential care in-house?
No, again, there's been no announcement or decision or anything along those lines. It's a frequently asked question, absolutely, but no, there's been no work done in that area. This is really about the system review delivered in December is about identifying some of the key issues. Yep. This reform plan, published 2 weeks ago, is about saying this is the vision for the future. We're focusing really hard on stabilising what is a difficult and challenging system. We start rebuilding where we can, and then we look at investment in other outcomes. So that's a future decision around investment, a future decision about the role of government compared to the role of the market. We're not near that decision yet.
So these fit for purpose is purely looking at the asset that the department would still...
It's about looking at the asset, it's about looking at placement options that require a residential component, it's about all of those elements of the program. But I would advise anybody listening to not read too much into one dot point. Yep. It's just about flagging that residential elements are an important part of the reform work.
But you can understand that, and this, as my colleague raised about that consultation, there is concern out there in the sector, and when that they're not sure what's happening.
Sure, and we speak with sector leaders multiple times every single day about this. We speak with the peaks, we speak with CEOs all the time. We are hearing the concerns, absolutely, but we're also seeking engagement from them about some of the challenges in the system that we're dealing with now and how we're all going to have to work together to fix some of those problems. So part of the conversation is about, yes, concerns about the reform, but I'm much more interested in how we're going to fix the situation that we have in front of us now, because it really is a stabilising period.
Yep. Just going back to the disability homes, I just wanted to clarify the number that are currently being used or being occupied for disability accommodation. Did you say 687?
646 of those enrolled properties as SDA are occupied for SDA use.
The answer to a supplementary question I got last year said it was 721 as of the 31st of July 2024. Does that mean there has been another shift of properties to...
What was that figure, Ms McLaren-Jones?
I had a total of 721 properties are occupied for disability accommodation services as of the 31st of July 2024.
Yeah, I think the remaining properties may not be SDA ones, because as you know, there are people who are over 65 who don't actually get access to NDIS, but do get access to aged care services.
So the figure I have is 715.
Yep, so, yep.
Yep, so it is, that's still the 700.
For disability accommodation.
Good, thank you. So just back to the 40 out-of-home care, or properties that are used for out-of-home care. Could you elaborate what they're actually used for? Or are they being, are they vacant for renovation at the moment?
Can you just repeat that question, sorry?
This is the 40 currently used properties for out-of-home care.
Okay. They are currently actually in out-of-home care, because I think you were quoting last year's numbers.
I've just got the figure as of the 31st of July.
Yeah, I've got 45.
Okay.
For out-of-home care. Just trying to find my note here. It's disappeared on me. Because it's further on. Trying to keep all these numbers in my head. Here we go. Out-of-home care, 45. Transitional housing, 10. Long-term housing is 2. And a women's refuge pilot, 1. That's as of 31st of December 2024.
Do you have a breakdown of what the 45 in out-of-home care is used for?
I think it's predominantly for residential care.
Okay. But not managed by the department. It's NGO
Mainly NGOs, yeah.
And is there any plan for the remaining 721 odd to be, as people vacate, to remain supporting whether it's in out-of-home care or transition to Homes New South Wales?
Yeah, I think you made that comment this morning in terms of the use of disability accommodation for other program types. Obviously, those particular houses are under the Community Welfare Act that you'd be familiar with. And this is for meanwhile use, so it's actually slightly different. So obviously we've got these vacant properties at the moment. We're looking at what we should be delivering in terms of contemporary residential services for people with disability under SDA. So we're using those properties where we need to obviously address the issue that the Minister talked about this morning in terms of the lack of housing across New South Wales. So we're obviously looking at the other vacant properties and looking at what's the best use of that, but there's been no decision at this point.
But they're remaining still with under the Minister for Disability Inclusion, not with Homes New South Wales.
Correct. There are actually, I think I mentioned it last year too, there are 12 of those properties that are actually owned by Homes New South Wales that we manage the leases on with the SDA providers.
Okay. I might move to some questions for the Commissioner. One of the recommendations out of the Disability Royal Commission, recommendation 11.3, referred to a one-stop shop complaint reporting referral and support service. The response by the New South Wales Government was that it was the responsibility of the Ageing and Disability Commissioner. Are you adequately resourced to be able to do that role?
I would say my understanding of the response was that the ADC fulfills a lot of that role already. So part of the responsibility, I guess, of the ADC and our legislation being so broad is that we do bring in a lot of matters relating to obviously adults with disability and older people, broader than what our the gap that we're kind of designed to fill. We did note, certainly in our feedback on the recommendations, was that what is proposed or has been proposed by the Royal Commission is broader though than what we do fulfil. So, for example, it isn't limited to adults, where our legislation is solely about adults. So looking at the ADC as fulfilling that role as being a one-stop shop more broadly for people with disability does present some challenges for us on top of what our existing mandate is. So there would need to be further consideration about whether it would sit, whether that role would sit if it progresses to the ADC, and certainly if we were to take that on, it would require additional resourcing.
And has any discussions occurred to date in relation to that and how it would be implemented?
The discussions so far have been more to inform the initial response to the DRC recommendations, so what our views were, and they are in line with what I've just said, that we fulfil most of that, or many elements of that, but there are some key parts where we don't. And I think in addition to children and young people, the additional piece was really about what's proposed by the DRC is very much a hands-on role of that body, so that matters coming in, you are kind of more intensively working on those to get them to the right place, and engagement with relevant agencies. We do a lot of that in relation to obviously abuse, neglect and exploitation matters, but broader concerns, for example, relating to conduct of government aid. There's a lot of kind of considerations around what is expected of that one-stop shop. That's beyond what certainly what we can fulfil at the moment.
Okay, thank you. Now, just in relation to reports that have come in, looking at your last report, I'm just interested to know the comparison between the previous year, because in your report last year you do talk about a significant increase in reports more broadly and that pressure it has on staff.
Yeah, so this is not limited to the last financial year. This has been throughout the life of the ADC, so 5.5 years so far that we do experience year on year growth, increasing demand for our services. I think a lot of that is to be expected. We did a lot of work, certainly in the early years, to get out to let the community know about the role that we have, to let people know about the helpline, to increase awareness, as is our responsibility, around abuse, neglect and exploitation of adults with disability and older people. And understandably that has an impact, as well as the work that we do on reports that also then, given that most of the reporters are service providers or staff, it helps to then drive also additional repeat contact about other matters that come to us. And I should flag at the outset, we're happy with increased reporting. We're happy that there's greater awareness of the ADC and there's greater awareness about abuse, neglect and exploitation of our cohorts. The challenge for us is that the original budget of the ADC understandably was based on paucity of data at that time, so not a lot of data other than the number of calls to the pre-existing elder abuse helpline, which is way under what we experience and way under what we experienced in the first year. But it was not adequate for even the first year of our operation, and it certainly isn't adequate for all of the subsequent years. So in that first 5 years, the volume of calls is a twofold increase on what we had in the first year. So 109%. The number of reports, 109% increase, 66% increase in the number of calls. The budget just doesn't support that. We're very fortunate, very glad to have the assistance of DCJ in providing us with temporary funds each year, but that is not a sustainable arrangement for the ADC and really prevents us from doing the type of planning and the work that we need to do on an ongoing basis to fulfil our responsibilities.
And I noticed, obviously, on your website, you've got a warning to say the length of time it will take. How many cases are not being reviewed in the time frame that is required?
So there is no required time frame. What we have done is, strong kind of believer in transparency and accountability. What we've really sought to do, and certainly towards the end of last year, was try to be much more transparent with the community about the demand and the impact on the ADC and our helpline, and also to manage expectations around how quickly we could respond. So I would flag, so the message on the website is very much about non-urgent matters within 4 weeks that continues to be the case. I would say we have been doing and continuing to do a lot of work in the ADC to improve our systems, and wherever we can gain efficiencies, we are seeking to do that. One of the things that we have done is improvements in responding to calls, so that calls to the ADC are now responded to either the same day or next business day. There are continuing delays, though, in responding to web reports to the ADC, where we do respond as fast as possible. Again, to non-urgent reports, though, it's a longer time frame before we can get back to them. I would say every matter, though, that comes in, so regardless of whether call, web report, email, etc., all matters are assessed for risk and are given a risk rating and a priority rating. So it's only the non-urgent matters that have a delay in response. The urgent matters are assessed as priority 1 or 2 and are responded to and allocated as a matter of priority.
And do you have a policy around time frame for the urgency category 1 and 2?
We do. I'm happy to provide that information. Yeah.
And then also, if there has been a delay or an extension in that period of time
Sure.
that you haven't been able to get to.
Yeah, happy to do that.
Just around the official community visits,
Yes.
In relation to out-of-home care residential homes, how many were conducted in the last 12 months? And what type of homes were they?
So in the last financial year, sorry, just bear with me for a second. So last financial year, visitors conducted 3,376 visits to 1,864 visitable services. The locations that they visited were a combination of ITC services and a small proportion of, I always call it voluntary out-of-home care, specialised substitute residential care settings, where the child or young person was in care for more than 3 months.
And what were the findings from those visits?
So it's a range of issues that the OCVs identify. The most common issues that are raised by OCVs, including in relation to out-of-home care, relate to the health needs and the individual needs of children and young people, and they continued to be the main issues raised last year. The visitors, though, have also, for the last couple of years, have been focusing on a range of long-standing systemic issues, and for residential out-of-home care services, in the past that's been leaving care planning in particular, compatibility, and last year we also looked at preventative health care. So there's a range of issues identified in the last annual report that go to those issues. This year they're focusing on, last financial year they were also focusing on education and the access to education. So there's a range of, key issues relating to the day-to-day support for children and young people, the adequacy of care that they're provided, and the impact on children and young people, some of which relate solely to individual children or to that particular residence, and a whole host of which are broader systemic issues that OCVs are raising and contributing to, hopefully, the work that's being done to address those.
And what is this year's focus?
So this year's financial year focus is again leaving care planning for children and young people, its involvement in decision making, and the other is staff training, so the adequacy of staff training.
Thank you.
Can I just ask now about the work being undertaken for the restoration of Aboriginal children and young people, and just perhaps to get an idea of, is there work, I did speak with the Minister briefly about it earlier, but is there work that you can explain tangibly in terms of reviewing what DCJ is doing to review restoration options now and what that looks like in terms of those children in care now?
Yes. So the first thing I would say is we are working with Dr. Newton on the Restoration Task Force work that she is leading. So my team is embedded with her and her team closely, looking at casework practice and identifying a new model. And I won't speak for her, of course, and the work that she's doing, because she could describe it. It's her work. But that is a critically important piece of work that we're collaborating with her on. DCJ also needs to, as you kind of suggested, do its own work around restoration practice, and there are pockets all around the state where restoration practice is great, but what we really require is a policy and practice framework and a resource plan for restoration work. So that's one of the things that we've started doing recently, and that involves drawing on expertise from our legal team, who are heavily involved in the children's court process, and bring a particular perspective to restoration work. It involves casework practitioners, it involves families, it involves carers, but it is challenging to very quickly shift to suddenly doing a whole program of restoration work across the state in a consistent way. Because while we're trying to build this model, we're also trying to improve performance around child protection response, and we're trying to improve performance in out-of-home care. So those sort of three things are happening at the same time. But what we intend to do in the next few weeks is take some people offline who can work full-time on the restoration work, and develop a model in close consultation with Dr. Newton and her work, so the two pieces of work are connected and have visibility of each other. And in the next few weeks, we hope to be in a better position to describe what a DCJ-led model could look like.
Mhm.
But the work has commenced, and one of the first things we will do is map examples of excellence and see what difference they are making. There's another key element here around connection to families and the role of families and giving families a voice, that family inclusion principle in driving restoration practice, and making sure that the parents of children who have been removed have a say and have a voice in the process, so that we can make sure that we are adding enough weight to that. Particularly parents who've been through the process of working with caseworkers, following a plan, making changes in their life, they need to have a strong voice in the restoration process, and that's a bit of culture change for everybody.
And so is it fair to say that it is a priority program of DCJ right now to be looking at
a huge priority.
restoration?
It is a huge priority in a group of other huge priorities, but it absolutely is a priority, yes.
Thank you.
Yes, so
So-
it is our number one placement priority is restoration,
Yep.
as you know from our
Yep.
public information, and we can't really achieve that unless we start re-engineering our operations and our policy work to drive that work.
Thank you. So just on that, how many Aboriginal children in out-of-home care have a case plan goal of restoration as it stands? And I acknowledge that I think in 23-24 it was 496 of 1,148.
Yeah, I have slightly different figures. So
Yep.
I have case plan restoration for Aboriginal kids who are PR to the Minister.
Yep.
And so at 30th of June 2024, 210 Aboriginal children had a case plan goal of restoration, and 247 non-Aboriginal children had a case plan goal of restoration.
So what would be the difference in my number to yours? Because
It
I've
could have
got
been the point in time of the snapshot, maybe. But
possibly.
happy to.
Yeah,
take
I mean,
that offline.
496 is more than 210, so I'm just curious as to where I'm sure. Anyway, okay. And so, I mean, would it be the intention to have a goal of, well, 100% of kids in care have got a restoration plan with some, provisional major exceptions?
Well,
Is
I
that-
think there are going to be exceptions.
Yeah, that,
Most certainly, yes. Not every child is suitable for restoration.
Yeah.
And that is the sad truth. But it's simply not the case that every child is ready for or suitable for restoration. But certainly, it needs to be very high. Our goal is to make it very high, not just to set a case plan goal of restoration, but to establish those building blocks around family connection.
Of how you get there.
And then informed casework that actually maintains those. And it also relates to our work in terms of recruiting and supporting carers who are motivated to support restoration and skilled in the complexity of working in a case plan that is focused around restoration. It requires a lot more connection, which can be challenging, but some carers are particularly interested in that work.
Yeah. So how many Aboriginal children exited care by way of restoration?
I have that number if you just give me a moment.
In 23-24,
Yep.
I think 159.
Yeah.
How many was that?
159.
159. And how many, so do we have any numbers about how we're tracking this year? So since then, do we have a point in time now?
I don't yet.
Okay.
Yeah.
And would you only get that figure of 24 to 25 at the end of...
Generally, yes.
Yeah.
Yes, but part of our work in this restoration reform work is going to be about accessing real-time data more effectively.
Do you expect, just from... I'm obviously asking you to have a bit of a lens over it. Do you think that there would be a similar figure, a higher figure, a lower figure for how we're tracking now, or we just can't know?
I don't think we can know, and I would note that the percentage of Aboriginal children restored is the same as the percentage of non-Aboriginal children restored in the last year. The restoration rates are very similar, and we absolutely want to see far more restoration, but we can't. Yeah, that is our vision and our goal, what we're working towards. But it's not a promise that we can make because there are so many variables in each case.
I think. I mean, I think the idea that there's still such a significant overrepresentation means that we would be trying to, exceed that number for Aboriginal children being restored.
Completely agree.
And I say that from the advocacy that I know the grandmas against removals consistently still.
And I can tell you there is advocacy within the department as well.
Of course.
Amongst many hundreds of staff.
Thank you. Could I just ask you about the switch off of the structured decision-making tool? I know the Minister was, we had a brief exchange.
Sure.
I'm just wondering, have you received feedback from the caseworkers about the tool, the interim tool, and what they're doing now?
Yeah, we have had a lot of feedback from practitioners. We have not yet had outcomes data. We're expecting that in the next few weeks.
Are there emerging trends? Is there?
Well, again, the trends will be in the data, which will be available soon. It is not available yet. But certainly a few observations from staff. I may have reported some of this at the last hearing, I can't remember. Maybe I didn't. But certainly staff, like any significant change process, took a bit of time to adjust to the process. A judgment-based decision approach around risk assessment requires lots of consultation, and one of the challenges is that it's often the same people being consulted internally, and that is something that
we did have a bit of a discussion.
We do need to manage that.
Yeah.
And it is not our intention for this to be the enduring approach. We are committed to working with ABSEC and ALS on an enduring risk assessment model, which puts in much more sustainable safeguards around decision making to support judgment.
So is it fair to say then in the current, sorry to interrupt, but is it fair to say that, do you think there are real differences with what's happening now compared to under the tool? And if so, what are some of those tangible examples?
Well, it stems from dropping the actuarial model. And all of those elements of a person's life and past don't factor into the decision as they did before. It focuses people, the idea is to focus people on the current risk, but also, and most importantly, the strengths and protective factors in the family and the broader family, and to bring the family to the table. That is the intention of the work, and that's what people are experiencing. But for some people it's a new way of working, and it requires support, and we don't pretend that it is the answer. It is an interim approach which has enabled us to switch off a system that was found to be biased.
And so what are you doing in terms of Aboriginal caseworkers and that carrying that additional cultural load that comes with that level of, it's that thing. It's like, this is what we want, but we know that this is the system that will ultimately lead to more humane approaches, more realistic, but what are we doing to actually support those people that are having to make those really hard decisions on spot, and particularly Aboriginal caseworkers in terms of the cultural?
It's part of our reform work, but I might throw to my colleague, Ms Dean, who's managing those caseworkers.
Thank you for the question, Ms Higginson. Firstly, a shout out to our Aboriginal workforce, because they're amazing. Acknowledge that they carry a significant cultural load. As they talk to me, they're 24/7. So, lots of us get to go home, but and away from work. But of course, our Aboriginal staff don't have that. For us, we're working in close collaboration with the state ARG. So the ARG is the Aboriginal Reference Group, which are representatives from across New South Wales in the Child Protection Division, where they are nominated and supported members and representatives from their local areas. A special call out to them, because actually they're celebrating 40 years this year, which is a significant achievement, especially acknowledging the past history of this agency and their ability to keep working with us. So we are working to acknowledge the cultural load. We are working in consultation with the state ARG to develop a strategic plan that will help take us forward in true collaboration, to acknowledge what they bring to the table and what they need to continue to contribute to a safe workplace where we are collectively working to get better outcomes for Aboriginal children, young peoples, their family and communities. In addition to that as well, we are working in regards to cultural supervision. And obviously that's not a white person, me sitting here telling them what it is they need. I'm listening to them around how can the department facilitate support and help them engage for cultural supervision. as well as increasing the cultural competency of our staff. That's incredibly important, whilst also acknowledging anti-racism action. So we are collectively working to make sure that our cultural leaders and our Aboriginal staff are safe and supported in the workplace, acknowledging their cultural load, and really working with them strategically to help them feel valued in the workplace and safe in the workplace.
Thank you. I asked the Minister earlier about the use of the emergency powers, and I'm just wondering. So one of the 9 priorities identified by the Minister following the review was, the reform was to review the use of those powers. I am informed that it's a serious issue still of concern for the FIT group and in particular the ALS. And I'm just wondering if you have numbers about the amount of children that were removed by warrant, if any.
So if I may, Ms Higginson, for that question, I've got a breakdown of emergency removals by district in recent times. Is it okay if I read that out to you?
Yep, that would be great.
So in relation to the proportionate rate for 23-24, so for Western Sydney, Nepean, Blue Mountains, there were 91. For Sydney, South East Sydney, Northern Sydney, there were 38. For Illawarra, Shoalhaven and Southern New South Wales, there were 63. For Southwestern Sydney, there were 44. For Murrumbidgee, Far West and Western New South Wales, there were 66. For Hunter and Central Coast, there were 55. For Mid-North Coast, Northern New South Wales and New England, there were 63. For statewide services, which would be the overall umbrella for the Joint Child Protection Response Program, JCPRP, there were 34. So for total for 23-24, there were 454 Aboriginal children and young people removed via emergency powers.
Thank you. And so, so given removal of children without a warrant is supposed to be an exception to the normal practice, what actions, I suppose, so what is the comparison figure for, I don't know if you have to do it by the district?
Sure, I can give you a total if you'd like, Ms Higginson.
Yeah.
So the if I take the earliest available data I have, it's 580 total for the year 2019-20.
For 1920, but so that's not a comparison for the 23-24 total.
I have so for 1920 the total was 580.
Yep.
There were significant increases for the 3 years following, so it went to 742.
Yeah.
618.
Yeah.
614, and then for 23-24 it was 454.
Right. And so then what? So in terms of so what are the numbers of children that were removed without a warrant, though?
I'd have to come back to you. As I understand it, the total entry into care number for 23-24 was 1,767 children. I don't have the Aboriginal versus non-Aboriginal breakdown though in that cohort, so I can take that on notice.
Okay, all right, thank you. So I think one of the points really that keeps being made to me is this. If the removal without warrant is supposed to be an exception to the normal practice, then what is DCJ? What actions are DCJ taking to enforce that requirement that it is, only at the emergency?
Yes. So in response to that, obviously reiterating what Minister Washington said this morning, we know we still have a lot more work to do. The things we're doing, though, obviously, are the SIDMAC panels.
Yep.
So obviously they've been established in all districts, and you did ask for some updated numbers. I think we have those. Ms. Jarrett might help me with those.
Yep.
While she's looking for those, in addition to the SIDMAC panels, obviously we're working hard to understand the impact of active efforts, and I would say that we're still immature in relation to really enhancing the active efforts requirements and making sure that we do avoid the use of emergency powers. The SIDMAC panels are due for review as well in coming months, so we're keen to understand whether they are still early enough in the process, if they're too late in the process, what the community representation looks like, and also how we can help ensure that we are still working to avoid the use of emergency removals, noting that it's highly likely there will still need to be some emergency removals throughout the course of time, and that's because there are some situations where children, young people are at immediate risk who are unable to stay there.
And so, thank you. And if I can get the district breakdowns, that would be great.
It's only from July to September 24. We'll get the next quarter data at the end of this month.
Yep.
So from July to September 2024, 129 Aboriginal children and young people completed a SIDMAC panel.
Yep.
But we can take on notice and get you more fulsome data from the previous year as well.
Thank you.
However long they've been operational, maybe not the full year.
Thank you, because that seems like, oh, that's July to December, okay.
Yeah, July to September. So it's only 3 months.
Okay.
Yeah.
All right. Yeah, I mean, it would be good, maybe if it could be taken on notice to try and get the figures so that we can, just so we can track and get some idea on how many, what is the outcomes and what is happening.
If I may, I'm sorry, I actually just have found it, if I could.
Thank you.
So I understand there's been 685 panels.
Right.
There have been 1,001 Aboriginal children discussed.
Okay.
And 595 did not enter care.
Right, I get it now. That sounds a bit more like what I was trying to get to.
Yeah, apologies for the delay.
No, that's fine.
Can I just add something to that, if that's okay?
Yeah.
It is a central part of our child protection policy reform work, and I heard your comment earlier about the ALS. And ALS are a key partner in our policy redesign, so they bring to the policy table all that experience and advocacy around emergency removals, which will be central to that work. And I also need to add the level of oversight, if you like, on this policy reform work. So I report, and the Minister also reports to the Ministerial Aboriginal Partnership Group every month on the reform work, and specifically on emergency removal power trends every month, so that those Aboriginal leaders are monitoring and holding us to account for that work.
Okay, thank you. Right, we get half each. You go for it.
Yeah. I've only got a couple more. One is just in relation to permanency goals. So we've already covered off restoration. Interested in the numbers around guardianship and adoption as well.
We do have those somewhere here. Yep.
Certainly. So the total, up to June 2024, the total restoration goal was 457. The total for children under PR to the Minister, permanency goal of guardianship was 585. The case plan goal for adoption was 196. The case plan goal for long-term care was 9,583. That's the breakdown.
That's fine. I might, just in relation to, what is the difference between de-identified and misidentified when it comes to Aboriginal children and young people in care?
Well, I guess de-identify is the action we would take if a child was misidentified on the system, so incorrectly identified through administrative error.
But there's no difference in pathway or anything like that. It's just it's a term that's used interchangeably.
Yes.
In effect. Okay.
It's a term we're leaning more towards using because, steering away from de-identify.
To use misidentified. Okay.
Yeah.
In the last 12 months or the last financial year, how many Aboriginal children have been misidentified?
So in terms of actually having their cultural status changed on the system, on Child Story, since January 23, up until March last year when the Minister ordered a pause, there were 101 children that had their cultural status changed. My division has just commenced a review of those decisions to make sure that we made the correct decisions. And we're also about to, so the pause was put into place until a final policy position is in place. We've been working with our community partners, including ABSEC and ALS and the Aboriginal Leadership Group on those on that policy, which is in draft, but they've asked for further community consultation, which we've agreed to, and we're coordinating that in partnership with them. We do recognise that while that work is happening, and it really isn't up to government to impose timeframes on that, there are children in the system that have been misidentified, and it impacts casework and court decisions. So we are proposing to implement an interim process which applies greater cultural safeguards, and those cultural safeguards include approvals by senior Aboriginal leaders in DCJ, including myself, and also sharing final decisions with local ACOs or a local ACO from that child's community. So we're just almost at the point of getting that approved and implemented, which means the pause will be lifted.
So the pause will be lifted for an interim policy, but there isn't a time frame for the...
Well, we're working to as soon as possible, but it really it's up to community who are going to participate in the consultation process, and as you would appreciate, it's the topic of identification is a very sort of fraught and contentious issue for many Aboriginal people and communities, so we need to approach the work really sensitively.
But do you have a time frame of actual consultation or anything like that?
We're scheduling. We hope that it will be they'll be completed before the end of October to December this year.
Thank you.
Can I just ask briefly, and I don't think we've covered it, but how many Aboriginal children have been transitioned from NGOs to ACOs since the last time the committee met?
So I can tell you we do our counts from July 22, which is when the government made a commitment to extend the time frame.
Yep.
So since July 22 to February this year, there have been 163 transfers from NGOs to ACOs. And important to note that of those, 129 occurred between January last year and February this year, I think, which indicates the additional sort of efforts we're making to expedite transitions.
Thank you. And what about transitions from DCJ case management to ACOs?
Yeah, between the 1st of July 22 again and the end of February this year, 283 children were transferred from DCJ to ACOs, and of those, 89 occurred in the last 12 months.
Right. And how many Aboriginal children have been transitioned from NGOs back to DCJ case management?
I don't have those figures. I've got figures from ACO transfers out of ACOs to NGOs and DCJ.
Oh yeah.
Yeah. I did. Sorry, hang on a moment. So from July 22 to December 24, there were 186 children transferred out of ACOs, including 100 transferred to NGOs and 86 transferred to DCJ. The reasons are varied. It might include whether it might be children living away from placement. It might be children that were determined not to be Aboriginal or Torres Strait Islander. It could be children with high needs that the ACOs aren't able to support those high needs. So, varied reasons.
Thank you. And so, is that something in terms of that, the reasons that are given? Are they put into a kind of feedback system that then helps understand, and is there a formalised system for that?
We have a dashboard.
Right.
We have a dashboard. It's not publicly available, but NGOs and ACOs have access to it. But we don't publicly report on the dashboard.
Yeah, okay. And what about, so I know this is a bit of a broader one, but so what progress is being made at the moment on the development of the ACO sector development strategy and enhancing, and assisting with the ACO development?
I can talk to that, and Anne might want to talk to that too. So we have committed, Anne's area, in partnerships, are leading in partnership with ABSEC, ACOs and other community partners, the development of an Aboriginal sector strengthening strategy or sector development strategy. So there's that commitment, and some early scoping has been done. I think they're about to start consultations around that. Something that has come through strongly from our community partners is that they don't want to be over consulted on things that, we already know what the issues are and where the growth needs to be. Certainly across districts, there has been a concerted effort to support communities who do want to increase their service footprint. There have been, I think, 2 new ACOs established in the child and family sector in the last 12 months. And I think a big part of that sector strengthening strategy is how do we support new and emerging ACOs to increase their future sustainability. So a key focus. Yep. I don't know if you want to add to that.
No, I think you've covered it well, Bianca.
Thank you. Okay, so I think we're now taking a short break. Is it question time? No questions. No, they're later. Not at the,
Afternoon tea.
Okay, so we're just going to take a short recess now, and then we.
Is it 15 minutes?
Yeah, it's a 15-minute recess, and then we'll come back. Thank you.
Okay. Formally, we have to come.
Is the thing we formally have to come back, and then we can. Yeah. Okay. Thank you. So we'll resume back in 15 minutes' time.
up north. So again, thank you very much for your time today.
Yeah.
Okay, so on that basis, we will wrap up the hearings early. All questions that were taken on notice, you will be contacted by the Secretariat in the usual course, and we will put all our SUPs on. And I'm looking at the government, and
No, I'm still banking my questions. So.
all those questions are banked until the next budget estimates hearing. And on behalf of the whole committee, I thank all of you, and we understand how much work goes into preparing for estimates in this very important accountability role that we all hold, and we're very, very grateful to all of you. So thank you.
Thank you.
Thank you.
Thanks very much.
Thank you.